All right, now we're recording. Perfect. All right, so, all right, like I said, welcome. Thanks for coming to the American Heart Association's Heartsaver CPR AED and First Aid course. We're going to first and foremost go through the first aid portion of the class. Yes.
She's not going to get she's rescheduled.
Okay. All right. Thank you for letting me know. Okay. So, today we're going to teach you a lot of things. We're going to go through responding to a first aid emergency and the steps for doing that. We're going to talk about personal protective equipment. We're going to have you practice while watching the video removing gloves. We're going to talk about some additional things, choking relief. We're going to talk about some survivor stories, breathing problems, including asthma. We're going to test you on controlling bleeding and bandaging. We're going to talk about allergic reactions, heart attack versus cardiac arrest. What else are we going to talk about? There's a lot we get into. We talk about things environmental. So we'll talk about heat-related, cold-related emergencies. We'll talk about bug bites, land and marine animal bites alike, I should say. We're going to talk about feigning diabetes, opioid overdoses, strokes and warning signs, or the acronym I should say for stroke. We'll talk about seizures and what to do for that. And yeah, external bleeding, and then of course bleeding control. What I am going to test you on today is, the first thing is the first aid steps. And then we'll test you on bleeding control. So basically you guys are just going to bandage each other, and then obviously know when to put a tourniquet on as well. So it's a lot. I'm not going to lie, it's a lot of video. It's very video driven, video based, which is why we do this first. So before I move on, I do need to make you aware of some things. Our bathrooms, first and foremost, are outside of this office. Okay, you go to the right, take a left, can't miss it. We have filtered water as well over there. I have to also let you know where our exits are, which is opposite sides of the building. There's stairs. Sometimes we do have issues with the elevator. Just so you guys know, our nearest AED is by the front door, this front door, our door, in a box. Yeah, we even have a bleeding control kit in there as well. So rest assured, you're in good hands as you are here at APHE. All right. Next question. Does anybody anticipate any difficulties as far as anyone have any back problems, medical conditions I need to be aware of? Okay. Perfect. If so, just let me know. I will accommodate. We'll work with them. All right. So I just want to say that a lot of this is retention as far as remembering what to do in certain situations. And it's physical as far as the CPR goes. So they're very big, the American Heart Association, they're very big on retention methods. And let me tell you, they really do get all the communities, at least national, involved in these statistics that they gather. And it takes a long time, 10 years actually, to gather all these statistics and come up with new guidelines every 5 years. And it's really interesting and it's intriguing how they do that. But the reason why information changes is just like anything else, even in the medical field, things change, right? So they try to change it for you better. That being said, we're gonna introduce you to first aid. We're gonna hear Alondra's story. One of the things that they incorporated is real life stories. So you're gonna be hearing stories from real life survivors from first aid, whether it was an emergency or just something that happened personally in their life or someone else that they loved. So before we move on, does anybody have any questions? Now, I'm going to hand out some stuff to you, okay? first off, I'm going to hand out some gloves to you. I'm going to have you remove the gloves as we are watching the video. It's not a test, but it's still good to know. I'm going to have you guys, no, these are just trainers. There's no needles. I'm going to have you guys try epinephrine on yourselves so you know how to use that. And then when we have to basically stop the video and test is, you know, the first aid basics portion and the control bleeding and bandaging, which I'll probably just do a little round robin here, and you'll bandage him, you'll bandage her, she'll bandage you. Right? Yeah, perfect. Okay, with that being said, here are your gloves. Okay. Part of your personal protective equipment. Now, what that might mean to you and your work might be different. I know for factory workers, they have safety glasses as part of their personal protective equipment. If you work with chemicals or chemical drums, it might also mean heavy duty gloves of some sort as well. So, or steel toes, depending upon, you know, what you do. So that might mean something different to everyone, but in any case, let's go ahead and begin the video.
Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or product. For the purposes of this video, actors may not always be shown wearing personal protective equipment.
So chipping away at the side of the mountain there. Next thing I know, I collapsed. I ruptured 2 of my discs. My friend, he found me. I'm just thankful that he knew exactly what to do. He saved my life.
First aid is the immediate care that you give someone who has an illness or injury. First aid can be provided for people who have minor illnesses and injuries, as well as when they have more serious problems. Providing first aid can help someone recover faster and more completely. In serious emergencies, first aid can mean the difference between life and death.
I live with asthma. It's hard sometimes when you're out of breath. I have to monitor that to make sure I don't overdo myself. It's still good to have like an inhaler at least around.
With the testimony of real-life rescuers and survivors, the knowledge of experts, as well as some helpful assistance, this Heartsaver first aid course from the American Heart Association will feature simulated demonstrations to teach you skills such as how to know when to call 911, stop external bleeding, apply a splint to a broken bone, know what to do if someone is having a heart attack or stroke, and even know what to do for animal and insect bites and stings.
When faced with one of these emergencies in real life, you may be hesitant to act, but with this course, you'll learn skills that can empower you to help someone and maybe even save their life.
Every state has Good Samaritan laws that protect you and others who give first aid and CPR in good faith and to the best of their abilities.
In general, having a plan is vital. Many schools and workplaces have emergency response plans in place. These plans can help guide you in an emergency. Adults and children who have pre-existing medical conditions like asthma or diabetes may have their own emergency action plans. So, check in with them to make sure you can prepare for emergencies at work or at home.
I climbed up on the desk to finish hanging up my artwork when I stepped down and I went down to the floor. I had a student with me who immediately ran down the hall to get help. I'm thankful that she was able to call 911. It's so important to know all of these things.
For emergencies at home, chat with your family to figure out the best way. As a healthcare professional, I've seen time and time again how actions by people like you can really make a difference. That's why we're here to learn.
Even by just remembering how important it is to quickly call 911 during an emergency, you could help save a person's life. Each one of us has the power to respond in an emergency. We're with you every step of the way. empowering you to help save a life.
All right. That's great instruction. Great introduction. I love it. Okay. All right. So let's hear the entire survivor story for Alondra. Then we'll move on to responding to a first aid emergency, but more importantly, knowing when there is one as well.
I always knew I wanted to be a teacher. I knew that was something that I wanted to do. It was just a blessing to be in the classroom working with children. We were putting out decorations up. I have a tendency to hang things higher so that they're kind of out of their reach. They're visible to the students, but they're not in a range where they can accidentally or on purpose pull it down. I had one of my students that came up to help me. He had one ladder, went to lunch and came back from lunch and the ladder was gone. I climbed up on the desk to finish hanging up my artwork. When I stepped down, I stepped into air and I went down to the floor. When you want to think about that, man, that just hurt just talking about it. I had broken this, but it wasn't just the wrist. I broke my elbow too, and I tore my shoulder. So it was the whole right side that had just gotten damaged from that traumatic experience. I had a student with me who immediately ran down the hall to get help. They were able to get another teacher to call 911. I was so lucky that I had her in the classroom with me. Because had she not, who knows what would have happened. Even in my mind, because I was supposed to bowl the next day, I'm saying to myself, oh, I'll be all right. I'll get up and I'll be able to bowl. But it was painful. I really missed bowling. I really did. I missed that whole season. After months, I decided I was going to go back and try to bowl again. And I started doing the left hand bowling, trying to see what I could do. And that was crazy. I rolled and I had those naysayers. I had those ones that said to me, if I was you, I'd quit. And I say, yeah, but you're not me. I was thankful that she was able to call 911. So she was wise and smart in that way. It's so important to know all of these things. And I'm just glad that I had the opportunity to learn all of these things for myself and to be able to encourage others to make sure you do it.
She got straight. All right. Now, all of this information is almost verbatim in your student manual if you do have one. If you don't have one, the online, at least the ebooks are relatively inexpensive. The paper books aren't that much more expensive than the electronic ones, if memory serves. So you're more than welcome to follow along as we go throughout the first aid portion of the class today. But let's talk about responding to a first aid emergency, and more importantly, like I said, when knowing when there is one.
When you encounter a first aid emergency, you might feel overwhelmed at first, but knowing what steps to take will help you react quickly and with confidence. Imagine that you arrive at work one day and see a coworker collapsed on the ground, not moving. What should you do? First, make sure the scene is safe. If there's a danger to you or others, like a moving vehicle, a chemical spill, a downed electrical wire, or a falling object, it needs to be addressed before you do anything else. You can't help anyone if you are in danger. Once you've ensured that you can act safely, say aloud, "The scene is safe." Next, check for responsiveness by tapping the person's shoulders and shouting, "Hey, are you okay? Are you okay?" In this scenario, the person is responsive, but only moans and groans. She is also moving a little bit. See if others are around to help by shouting, "Help! Somebody help me!" Once help arrives, point and shout, "You, call 911, and you, get the first aid kit and an AED." To avoid confusion, it's important to point at and designate a specific person for each task. If no one comes to help and you have a phone, call 911 and put it on speaker mode so that you can hear the emergency dispatcher's instructions. Stay on the phone until emergency responders arrive. Be prepared to provide some basic information, like your exact location, what happened, and whether the person is breathing. Your answers will help the dispatcher assess the situation and send the right people to help. If needed, send someone to meet the emergency responders. If you're alone and don't have a phone, leave the injured person while you go call 911 and get the first aid kit and an AED if there's one nearby. Next, check for breathing. Scan the person's chest for signs of breathing for at least 5, but no more than 10 seconds. Look to see if their chest rises and falls. Breathing seems normal here, so let's look for any obvious signs of injury. Remember, remain calm and stay focused. Look for bleeding, broken bones, burns, bumps, or anything out of the ordinary that we should address. Next, check for medical information jewelry, like a bracelet or necklace, which can help emergency responders when they arrive. It's important not to move an injured or ill person unless they or you are in danger, or you need to move them as part of their care. If you have to move the person, it's important to avoid twisting or turning their head or neck, unless it's necessary to either move them out of danger or turn them face up to provide CPR. Those are the steps to take if someone is responsive. But what if the injured person doesn't blink, move, or speak? That would mean they're unresponsive, and you need to act immediately. If the person is unresponsive and not breathing or not breathing normally, start CPR immediately and use the AED as soon as it arrives. Keep performing CPR and using the AED until someone else takes over, emergency responders arrive, or the person starts to respond. Finally, if the person is unresponsive, but they're still breathing normally, shout for help and call 911. If they haven't experienced any trauma or injuries, place them in the recovery position and stay with them until emergency responders arrive. To do this, gently turn their head to the left. Place their left arm at a right angle to their body and put their right hand under their left cheek. Then bend their right knee and roll them onto their left side. This position will help prevent choking if they vomit. Once they're in the recovery position, gently open their airway by tilting their head back and lifting their chin. Check to make sure nothing is blocking the airway and continue to closely monitor the person's breathing and level of responsiveness until emergency responders arrive. When you follow these steps, you're providing critical help to an injured person who needs you. Your actions in an emergency can make a difference.
Okay, so just to explain a couple of things, if you can't visually see what the problem is, or if they can't tell you what the problem is, chances are there might be some underlying issue, which is why they talk about the recovery position. This will help keep their airway open in case anything comes up, so to speak. A lot of the times, people pass away in their sleep from asphyxiation. And that's from literally choking on their own vomit, choking even. So this is a really good way to help the person breathe until advanced help arrives. So again, just to kind of reiterate, okay, we want to make sure the scene is safe. We don't want 2 victims, right? A lot of things can make a scene unsafe. I'm going to tell you what number 1 is: people. People make a scene unsafe. So when he said, if you notice that he, was pointing, you call 911 and get an AED, and he was giving jobs out to people, there's good reason for that. This will not only help, advanced help to get to you in a timely manner, but this will give them something to do, a job to do. But pointing to someone will create accountability. Otherwise, have you ever noticed if you just generally say someone call 911, nobody does, and they look to the person right next to them? Right, and there's a reason, like, everybody's scared, and that's okay, because everybody's human at the end of the day. So pointing to somebody and saying, you call 911, you get the nearest AED, you go to the front of the building and direct emergency personnel where we are. I would probably go as far as, staggering people throughout the building if they don't already have an emergency plan, just so they come to you in a timely manner. Obviously, knowing where your location is will help as well. So this is just the start of it. Okay. You tap and shout and check for responsiveness, okay? And you want to be, think about it, you want to be a little bit obnoxious about it, okay? If you can wake somebody up by just tapping and shouting, hey, 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 are you okay? Awesome. No cardiac arrest, nothing's wrong, or you can ask them what is wrong, right? And then shout for help, send someone to activate emergency response or call 911 and find the nearest AED that can find. Check for breathing, okay? This is what I call, the next steps are what I call the B's, okay? And I say that, and it's easier to remember because the first B you're looking for is breathing. Is the person breathing? That's the most important one. If they're breathing normally, something else is going on. Let's go to the next B. Any broken bones, so any obvious signs of injury, any broken bones, bleeding, bruising, bites, anything of that sort, the B's, you know. And if you can't see anything, do they have any type of medical information, jewelry? Tattoos are becoming a big thing now. I just had in the last month 2 people come in my class, and they both had tattoos of their history, basically. One was allergic to penicillin. That's a big one, you know, and the other one had a heart condition. So, yep, big, right here on the forearm. I thought that was very smart.
Wow.
They were both paramedics, so I'm sure they've been there, done that, you know, but I thought it was very smart, and it would alleviate a lot of, you know, trying to figure out the person's personal information, and therefore less of a delay for you know, survival, I guess. And then if you can't figure out what's going on by seeing anything visually, and sometimes it's not, you know, in your face, here it is. Sometimes you got to play little mini detectives. Like if you see a crane above you and, you know, a steel beam on the ground, chances are the person got hit in the head. You know what I mean? Sometimes you just got to put 2 and 2 together. Maybe there's an open pill bottle somewhere. You know, sometimes you just got to play a little mini detective and kind of come to the conclusion of what it could be. 911 is a great help. They will take you through steps. They've done this a time or 2. They're there to help for sure. And then they'll also let you know the ETA of paramedics. If the person is not injured and there's no medical information, jewelry, again, recovery position will help keep that airway open until EMS arrives, okay? Otherwise, if they're verbal, ask them what the problem is and if you can help them. They have that right to refuse as well. So what I'm about to test you on is this very thing, okay? So someone's on the ground. Oh no, and you know, oh no, it's John. Scene is safe, okay? And I'm gonna test you on this in just a minute here, okay? So I'm gonna say first, before I approach, gloves on, okay? My gloves are on. I'm not gonna just put them on it all the time. So my gloves are on, okay? The scene is safe. Oh no, John. Hey, are you okay? Are you okay? Help, someone help. Call 911. You find the nearest AD you can find. And then I'm going to scan the chest, and I'm going to get low to do this, okay? I'm going to get low to see if there's breathing. No more than 10 seconds, no less than 5. No breathing. Okay, if there's no breathing, then we're going to begin CPR, okay? If there's breathing, if they're breathing normally, something else is going on. Okay, then you got to ask yourself, what can I see? Noticeable, you know, broken bones, bleeding, burns, bite, bruising even, any accumulation of blood. Sometimes people pass out from the you know, just from seeing blood itself. And if you can't figure it out, any type of medical information, jewelry, if they're your buddy, you know that they have a medical condition, let 911 know that as well. They might have some additional first aid steps for you to take. And if you still can't figure it out, again, we're going to put the person, it's really hard to do this when you don't have any arms and legs, but recovery position, right? So one hand like this, okay, and then the leg over, and you want to keep that airway open, okay, and just like that. And it should typically just stay open. Any questions? Okay, this is really important. This is, you know, they're not just down because they're down for a reason, okay?
Right.
If you're ever not sure what to do, okay, if you know that they're not breathing, you know, don't delay. just begin CPR. Right? And if you're not sure, just begin CPR. So wake up very quickly.
Right.
You know what I mean? If somebody's down there down for a reason, and it's most likely cardiac, okay, I'm not gonna lie. But if you are in a situation where there could be other things that happen, you know, CPR is always your go-to. Otherwise, you know, kind of make your own conclusions, draw your own conclusions, make a hypothesis. So, all right. With that being said, I'm gonna have each of you. I don't know why we don't do this with the video. It's a little. I don't know why. They used to do all these steps with the video. This one we don't do with the video, and I don't know why, and I don't have an answer for you. However, I think it's because it's fresh in our minds right now. We're gonna do it right now, okay?
Okay.
I'm gonna have all of you just stand up and do it at the same time. Okay. So you go. Please situate them accordingly. I just am kind of like throwing them. just throwing them. Okay. Here's your guy. All right. So when we approach the scene, what do we do first?
Check to see if it's safe.
All right. So I want to hear that.
Check to see if it's
Safe.
safe.
So scene safe.
The
Scene
scene
safe.
safe.
Perfect.
Yes.
How do we check for a response?
Well, out here.
Yep.
Are
you
okay?
Are you okay? Are you okay?
Are you okay?
Help, help.
Yep. Right.
You get the AED, you call 911.
Perfect. And then we scan the chest to see if they're breathing. And how long do we do that for?
5 seconds, no
less
longer than 10 seconds.
Perfect. If there is no breathing, then we begin CPR. But if they're breathing, what are we going to be looking for the site?
We're gonna see if there's any bleeding.
Bruises,
The beads,
elbows.
right? It's the
Right.
beads, right? It's the
Right.
easiest thing to remember.
Right.
If you don't see anything or any type of medical information jewelry, what would you do then?
Scan the area to see if there's any,
Investigate.
Yes.
yeah,
Okay, let's say you can't figure it out then. What would you do to help this person until advanced
if
help?
they
arrives?
breathe and then you do the recovery.
Yep,
Right.
Strap
recovery
the arm up
position.
there,
You got it.
arm under here.
Yep. And your
You know,
book has really good steps for that.
First
as
you
well.
do the, put your head over there. So that-
Perfect.
Yes.
Yeah. It's like lying in your bed, right? I mean, that's how I think of it.
Right.
Yep. Perfect. All right. Great. Go ahead, take a seat. So that's the most important one, knowing there's a first aid emergency. Now, I always get the question, well, where is the nearest AED if we don't have one at work? Great question. There are apps out there that can show you where the nearest AED is, but usually any government buildings have one. So if you ever notice that the post office is strategically put in the middle of a town, they're usually there. So they're post office, library, government buildings. So
School.
police station, schools, especially, there's several at schools. Very good locations to try to find an AED or have someone go run there to get it. If you know, like definitively there's not one anywhere near you, do what you can for the person until advanced help arrives. And that's all you can do. You can only do so much,
Right.
if you know it's near, great. If it's 20 miles away, I mean, at that point, you're going to have to do what you can. Okay. Okay. Great job. Moving on. Personal protective equipment. So you got to make sure you're safe yourself before you help, especially when blood is involved. So I'm going to hand out, did I hand out gloves already?
Yes.
Perfect. We're going to practice with the video, removing gloves, all right? And I'm going to put squirt of hand sanitizer on each of your palms to indicate blood, okay? And the name of the game is don't touch the outer side of the glove. So
Okay.
I'm just going to show you real quickly how we remove gloves so we don't touch the blood ourselves. Okay, so after we have the gloves on, okay. Oh no, I have blood all over my hands. What am I going to do? So what we do is we pinch and we put this glove inside out. They say cup it. I say scrunch it into a ball and close your fist. And then 2 fingers underneath the glove, inside out. Okay. And then we want to dispose of them properly. biohazard bag or container preferably. Otherwise, we want a sealed bag, like a Ziploc bag type thing, okay? And then seal it, okay? Either give it to the medical professional, or if there's a biohazard waste pickup area as well, that will. Okay, perfect. I'm gonna have you guys, you
Oh, okay.
wanna put them on, try it? You wanna try it out?
Rub them together.
Yeah. If you can take them off without touching the other side. Yeah, finish inside out. Yep. You know, it's hard, isn't it? Yep. Shimmy it out of there, there you go. And then close your hand around the glove. And then, yep, close your fist. Perfect. And then inside out. Perfect. And then you would dispose of the gloves properly. Okay. Okay, I'll dispose of them for you. It's not a real emergency. Okay. All right. Oh, yeah. Okay. Here you go. Ready? All right. Try it out. All right. Your hands are full of blood. You now have to remove your gloves. Remove your gloves appropriately. Go ahead. Yep. Close your fists inside out. Perfect. Perfect. Awesome. Yay. You did it. Great job, guys. Great, great job. Okay. All right. Personal protective equipment.
Personal protective equipment, or PPE, includes vital tools to keep you safe when providing first aid. You never know what you might come in contact with when helping someone who's ill or injured. People rarely get an infection from providing first aid, but to be safe, we treat all bodily fluids as though they contain bacteria and viruses that can cause infections. To protect yourself, use PPE every time you provide first aid. Some common pieces of PPE include the following items. Medical gloves. These should be non-latex if possible. Wear them every time you give first aid. Goggles and safety glasses. These are vital if the ill or injured person is bleeding or vomiting. Face masks. Use a face mask anytime there's a lot of blood or there's a possibility of a respiratory infection. After you give first aid, be sure to remove your gloves properly. Dispose of them by following your organization's plan for hazardous waste disposal. Proper glove removal ensures that you don't get blood or bodily fluids on yourself. It also helps keep potentially hazardous materials inside the gloves. Watch as we show you the best way to remove them. Grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other gloved hand. Place 2 fingers of your bare hand inside the cuff of the glove that's still on your other hand. Peel that glove off so that it comes off inside out with the first glove inside of it. Dispose of the gloves in a hazardous waste container or trash can or per your company's policies. After you remove the gloves, wash your hands thoroughly. To do this, wet your hands with clean, warm water. Apply soap. Rub your hands together and scrub all surfaces of your hands for 20 seconds. Don't forget to scrub between your fingers and the backs of your hands. Rinse your hands with lots of running water. Then dry your hands and turn off the faucet with a paper towel if possible. Hand sanitizer can work too if you don't have immediate access to soap and water. But if blood or bodily fluids get on your skin, washing with soap and water is best. If PPE isn't available during an emergency, you should use your best judgment to give first aid. If anyone's blood touches you or gets in your mouth or eyes, you should clean it off as soon as possible. And be sure to let your workplace supervisor or medical personnel know about any exposure to. Using PPE and washing your hands every time you provide first aid is the best way to guard against a possible infection. That way, you can protect yourself while giving the life-saving help an injured person needs.
Yes. So that's the other thing I didn't mention was, and I thought this would go without saying, but wash your hands as soon as you get to a faucet and you have soap, wash your hands, accordingly. Hand sanitizer is a good secondary until you can get to, a sink where you can then wash your hands appropriately for sure. And like he said, it's the best defense against infection, illnesses, period, we all know that, with COVID, so, which I'm surprised they didn't mention. All right, any questions so far? No. All right, so these are the basics. Now, we're gonna talk about, what do we got? Let me just think about this, because we might get into choking relief. Let me just check something. Yeah, okay. So we're gonna get into choking relief during the CPR. Yeah, I just had to make sure it was there. All right. So yeah, we're going to talk about Ben's story, breathing problems and asthma, and how to use I think a metered dose inhaler if memory serves, allergic reactions, heart attack versus cardiac arrest, and then we'll talk about Finn and Karen's survival story.
Good.
I live with asthma. I have to monitor that sometimes to make sure I don't overdo myself. I really like doing sports like basketball. I do more throwing events because I'm not a good runner. I have like dwarfism, which makes me smaller. I had a previous band, but that one kind of fell apart because like too many friend issues. But then we started a boy band. I kind of want to do saxophone. It's hard to do sometimes when you're out of breath, but most of the time I don't use my inhaler unless it's really like bad. One night I was really hot. I was sweating a lot. It hurt and I was wheezing a lot. I got worse and I got rushed to the hospital. They hooked me up to an IV and they started pumping medicine into me. I stayed in the hospital for a while and like I got better. Like both of my parents know medical stuff and how to tackle emergencies, but it's still good to have like an inhaler at least around. My parents care for me, look out for me. I know I need to stay strong in order to have them stay strong. You want to be optimistic about the situation. What I'm excited for, I'm just looking forward to like seeing what life gives me and how I'll tackle the problems,
Right. Breathing problems and asthma.
Someone can develop a mild or severe breathing problem for many reasons. Breathing problems can be caused by chronic medical conditions such as asthma or something like an allergic reaction. Asthma attacks can be scary, so let's talk about how you can help someone who is having an asthma attack. Someone having an asthma attack may breathe very fast or very slowly, cough, have trouble with every breath, or breathe noisily, like with a wheeze or rattling sound. They may only be able to say a few words at a time. In severe cases, their lips, nail beds, or skin may turn pale or have bluish or grayish color. People with asthma often carry a rescue inhaler in case they have trouble breathing. The inhaler delivers medication into the person's lungs, which helps them breathe easier within minutes after using it. An inhaler has a medicine canister and a mouthpiece. Some inhalers come with a spacer or chamber. This tube attaches to the inhaler and helps the person get more of the medication into their lungs. At times, a person can have such a hard time breathing that they need help using their inhaler. You should be ready to assemble the inhaler if necessary and help them. If someone is having breathing problems due to asthma, ask them, "Do you need help?" If the answer is yes, ask, "Do you have your inhaler?" If the person has their inhaler, help them use it if needed. To help someone use an inhaler, remove the cap and shake the inhaler well. If a spacer is available, attach it to the mouthpiece of the inhaler. Have the person breathe out all the way. This may be difficult during an asthma attack. Place the mouthpiece between their teeth and have them seal their lips around it. As they start to breathe in, press down on the inhaler canister once. Have them breathe in slowly and deeply for 5 seconds. Next, have them hold their breath for up to 10 seconds to allow the medicine to reach their lungs. Repeat this for each puff indicated on the inhaler. Generally, this is 2 puffs total. Finally, replace the cap on the inhaler. Hopefully that will be it, but some situations may require you to call 911 and get an AED, such as if the person doesn't have their medicine, they aren't getting better or are getting worse after using their medicine, they're having trouble speaking, or they become unresponsive. You're now prepared to quickly help someone experiencing breathing problems, such as asthma.
Okay. So again, how long should someone hold their breath after using an inhaler?
After
10 seconds?
Yep, up to 10 seconds, yep. This will allow the medicine to reach their lungs.
If-
Okay,
if they're using a spacer, wouldn't that delay the, if they have the thing right to their mouth, they can get it faster and more, right, than if they have a spacer in between.
you would think that,
Yeah.
but no, it's actually the opposite. So it gets more concentrated in the chamber. And it's more, how can I say, that's why I call it a metered dose, because they can actually measure it. Does that make sense? Okay. All right. We're going to talk about allergic reactions and how to use an epinephrine pen. And I'm going to hand one out to each of you, okay?
Pronounce that word again.
What?
Epinephrine.
Epinephrine, an EpiPen. An EpiPen?
Yeah, EpiPen,
Yeah.
epinephrine.
So, someone's allergic to bees, okay, and they pop up, or shellfish. They may need to be administered their epinephrine pen. They usually come in a double pack, right? You always want to read the directions. Not all of them have the same exact directions, okay? So this one, for instance, which is, I would say the most common one, pull off blue safety release, swing, firmly push orange tip against thigh, outer thigh that is, so it clicks. Hold on thigh 10 seconds to stimulate the drug delivery. So 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull straight out, and then you rub that area for an additional 10 seconds to even more stimulate that drug delivery as well. We always say blue to the sky, orange to the thigh. All right, this one is pull off gray safety release, jab, black, hit firmly into the outer thigh and hold it in place until it clicks. Now the reason why, so 2, 3, 4, 5, 6, 7, 8, 9, 10, straight out. The reason why most people, and why we suggest you're going to have to help someone, or you're going to have to help administer this, okay? You have to understand the needle is like that big. Nobody wants to poke themselves with a needle that big, okay? And they're just trying to breathe and worrying about that. So they're going to need help, okay? They know they're made very aware of what is about to happen. I know pharmacists, they have to make them very aware of what the steps are, what they need to tell people that are around them, and how to use an epinephrine pen. So I'm going to hand these around.
Have anyone ever told you the degree of pain when you stick them like that? Or when
It doesn't feel good.
Right,
Yeah,
I'm saying, like how bad is it, if the needle's that long?
It hurts.
Yeah.
It hurts. I mean, I don't know what I can compare it to because I don't need an EpiPen.
Right, that's why I said if someone told you.
But compared to death, I would take that stab. It's gonna, and you'll be able to notice the change within minutes. So just kind of keep a watch on. So go ahead and try it out.
Okay, pull it up and break safe.
No, there's no needle. Exactly.
1, 2, 3, 4, 5, 6,
Yep.
7, 8, 9, 10.
Yep. And then straight out. Yep. And then you want to give the pen to paramedics when they do come, or put in a biohazard container. All right. Here.
push it out.
Try it out. See this one too. One. Right. Never put your thumb on top though, because the needle comes out of one end. Yep, always just hold it in the middle. You got it. Yep. Yep. Straight out, rub that area. Yep. Obviously, we would count slower.
Yeah, I know. I was saying that too when you was counting.
Right, right. Yeah, so this pinches. Yep.
You know, and my granddaughter had one in her car. I'm like, so I don't know if there's anything wrong with her. So I was shocked to see it. I'm like, what the heck she doing that in there?
Yeah.
So now I got to ask her what's wrong, why she carrying her.
She's probably just allergic to something,
Yeah.
you know, it'll help her breathe. Now, you know, like any other medicine, the medicine can go bad. Okay. So if you don't see within minutes change, you might have to administer the second dose.
Okay.
So they're going to go through all this right now.
And it keeps 2 doses in one thing?
It does. It always comes
Oh.
in 2 doses. Yep.
Just relax that.
Allergies are quite common, but for some people, an allergic reaction can quickly turn into a medical emergency. Someone who's experiencing a mild allergic reaction might sneeze or have a stuffy nose, have itching around the eyes or on the skin, or have a raised red rash on their skin called hives. But the true medical emergency is a severe allergic reaction. Many things can produce a severe allergic reaction, such as medications and insect bites and stings, especially bee stings. Foods like dairy, nuts, eggs, and seafood are other common causes of allergic reactions. Someone who's having a severe allergic reaction might have trouble breathing, their tongue and face might swell up, their heart might beat quickly, and they might feel nauseous or dizzy. If you see any of these signs, you need to help the person immediately to prevent further complications. Say you're with a child who has a severe nut allergy. She eats a cookie her friend gives her, unaware the cookie has nuts in it. Almost immediately, the child's tongue swells up and she starts gasping. What do you do? When someone has a severe allergic reaction, they need help fast. You should call 911 and send someone to get the child's epinephrine auto-injector, a first aid kit, and an AED if one is available. If the person has a history of severe allergic reactions, there's a good chance they'll have an epinephrine auto-injector. This is a prescribed device that contains a dose of epinephrine, a medication that decreases the body's response to an allergen and helps the person breathe more easily. It can be a lifesaver in these situations. People with severe allergies who have an epinephrine auto-injector should always carry it with them. Epinephrine dosages are different for children and adults though, so be sure you are using the person's prescribed device. People with severe allergies typically know how and when to use their auto-injector. But if they need help administering the injection, as a child might, you're allowed to help them. There are a few different types of epinephrine auto-injectors. In this video, we'll focus on the epinephrine pen. Start by holding the auto-injector in your fist without touching the tip, where there's a needle. Take off the safety cap. Have the person sit down while you hold their leg firmly in place. You can give the shot through the person's clothes or on their bare skin. Press the tip of the auto-injector hard against the side of the person's outer thigh, about halfway between the hip and the knee. Hold the leg still while the needle is in place. Follow the instructions on the device for how long to hold the needle in place. Once you're done, pull the auto-injector straight out and replace the safety cap, making sure not to touch the needle. Note the time. Rub the spot where the shot was given for about 10 seconds. If you forget how to use the epinephrine auto-injector in an emergency, you can typically find instructions on the auto-injector itself. When emergency responders arrive, tell them what time you gave the injection and give them the epinephrine auto-injector for proper disposal. Report what caused the reaction, if you know, or save a sample of what seems to have caused the reaction. If the person doesn't get better, or if emergency responders don't arrive within 5 to 10 minutes after you call them, consider giving the person a second dose of epinephrine if one is available. Watch for signs of cardiac arrest and be ready to start CPR if needed. Even if the person gets better with a single dose of epinephrine, they should still follow up with a healthcare professional. You can now confidently identify the signs of a severe allergic reaction and help someone use their epinephrine auto-injector.
All right, again, so when using an EpiPen, epinephrine auto-injector, Can you give the injection through clothes or does it have to be on bare skin?
Oh,
It can be either or. Yep, exactly. So you don't have to have them expose their thigh. It goes right through the clothes, no problem. Okay. Awesome sauce.
What if they don't have one of those?
An EpiPen?
Yes.
Oh, what I would do. Have you ever seen the movie Hitch? Will Smith. So he goes on a blind date and he finds out he's allergic to shellfish. And he starts puffing up immediately. It's kind of funny, but it's not because he like buys all this Benadryl. Basically, just starts drinking the Benadryl. So what I would do is I would probably give myself Benadryl until I could get an epinephrine pen or get to the nearest hospital. That would be the only thing I could think of. Yeah,
Benadryl.
I mean, yeah, for an allergic reaction. I mean, it's not instantaneous. You have to understand. But I mean, if all else fails and that's all you had,
It works.
I mean,
It works for me.
it works for me too. It's just, you're not gonna always have that there. But same goes for, for asthma. If their inhaler, is out, the thing that you can do for someone, the best thing you can do, is to calm them down. Hyperventilating, and same goes with EpiPens. If somebody's an epinephrine pen, they are having trouble breathing, calm them down. Having them hyperventilate will just get that blood pumping, and therefore kind of closing the airway as well. So make sure that they're calm. If that means, have them, sit down on the ground, elevate their legs, whatever you can do to calm them down is probably the best thing that you can do. Okay, great questions. Heart attack versus cardiac arrest.
It's not uncommon for people to use the terms cardiac arrest and heart attack interchangeably, but these two emergencies are not the same. Cardiac arrest is an electrical problem that happens when the heart stops beating and no longer pumps blood or oxygen to vital organs. During cardiac arrest, a person will become unresponsive and collapse. They can look like they are having a seizure for the first few minutes. They will stop breathing or may only gasp, which can sound like a snort, snore, or groan. A heart attack is a blood flow problem that occurs when a clot or blockage forms in a blood vessel in the heart, stopping oxygen-filled blood from reaching the heart muscle. When this happens, a part of the heart muscle starts to die from lack of oxygen, so the heart can't pump enough blood throughout the body. A heart attack can sometimes lead to a cardiac arrest. It's important to know the difference between cardiac arrest and a heart attack because each emergency might call for a different response. For example, a person in cardiac arrest requires immediate help. You should always perform CPR. A person having a heart attack does not need CPR, but they still need help immediately. You might encounter someone experiencing the symptoms of a heart attack anywhere, maybe even in the middle of your workday. So let's go over the symptoms to look for so that you can be ready to respond quickly. A heart attack often involves discomfort in the center of the chest that lasts more than a few minutes, but that goes away and comes back with stress or activity. It can feel like uncomfortable pressure, squeezing, fullness, or pain, and it may be mistaken for heartburn or indigestion. Discomfort or pain also may appear in one or both arms or in the upper back, neck, jaw, shoulder, or stomach. Other signs of a heart attack may include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, lightheadedness, and a feeling of extreme tiredness or fatigue. It's important to understand that anyone can experience a heart attack. For women, people with diabetes, and older adults, symptoms can be more subtle and may not include chest pain. Many people will ignore their discomfort or they won't think it's a sign of a heart attack. But if you suspect someone is having a heart attack, act quickly. Start by calling 911 and getting a first aid kit and an AED. If someone is with you, have them do this while you stay with the person. Then ensure that the person stays calm while you wait for emergency responders to arrive. If you're comfortable doing so, and if the person doesn't have an allergy to aspirin, serious bleeding, or signs of a stroke, have them chew and swallow 1 adult aspirin or 2 to 4 low-dose aspirins. Finally, it's important to stay close in case the person becomes unresponsive or goes into cardiac arrest. If they do, be prepared to start CPR and use the AED. By quickly recognizing the signs of a heart attack and immediately calling 911, you can help prevent further damage to the person's heart and improve their chances of recovery.
There's some chewable aspirin out there that are faster reacting. They have a decent flavor, just so that you know. Okay. Again, what are some signs and symptoms of a heart attack? Like the main ones.
Chest pain,
Mm-hmm.
shortness of breath,
Mm-hmm.
arm tingling.
Yep. Yep.
Who was it? Cold sweating?
Oh, yeah.
Yes.
Sweating.
Oh gosh, yes. Yeah, they will be sweating.
Fatigue.
Oh yes. And they may be they may have pain in their upper back, neck, jaw, shoulder, even stomach, which can make it hard to determine that is actually what's going on. I can just hear my grandmother. I grew up in the Depression. We didn't go to the hospital unless we were bleeding out of our eyes. I just am hearing my and it's, it's better to be safe than sorry. And that is for sure. But, this might seem like a multitude of, symptoms for different things.
Yeah.
I guess my suggestion would just be, make the best decision that you can. And just notice the signs, sweating is a big one. They will not look well. And most of the time it's discomfort in the chest. But not always. All right. Finn and Karen's survivor story.
Quick question.
Yeah.
If you're not around and someone's having a heart attack, from the time they had a heart attack to cardiac arrest, what's the length of time average? Before they get there?
There's no set time.
Because you don't know how this might be.
Yeah, I mean, there's no set time. We don't know how much has been damaged or if this isn't the first time as well. There's no set time. There are some steps you can take to help prevent, or I should say delay further symptoms, and that would be low dose aspirin, until they can get to, get that additional help, or to the hospital, the nearest hospital in a timely manner. Okay. Next,
My school starts at 8:30. It's 5 minutes away. There was 2 minutes until class, and we started running. When I got there, I felt a little bit dizzy. Next thing I know, I fainted, and I woke up on the floor. My school is very fun. I like to read, I like to dance, and I like to sing. I'm also doing a ballet and an acrobatics class. It was just like any other normal day. We were usually really late. We didn't have time to eat breakfast. We throw on our shoes, grab our lunch, and then I'm running with my mom. When I got there, I felt a little bit dizzy. Next thing I know, I fainted. When I went down, my mom grabbed my lunchbox and put it under my head.
The teacher that was with us, Elizabeth, she called 911. She was beating my mind that I was very afraid. An ambulance came and the paramedics checked her out.
When we got to the hospital, we sat in the waiting room. They ran a bunch of tests because one of my relatives had this heart problem.
We went to the cardiologist and she had more detailed testing. Thank goodness everything was fine.
I'm really happy that my teacher could help me. When I'm older, I would like to help other people who are in the same situation.
It's so important to have those skills to be able to help people because you never know, and it might be just you. I was just very, very lucky to have somebody there who knew what to do.
What would it be?
Okay, now we're gonna talk about fainting and what to do for someone who gets fainted.
It may not be often that you witness someone fainting, but if you do, you can be more than just a witness. You can help. Fainting happens when there isn't enough blood getting to the brain. A person who faints usually feels dizzy and then becomes unresponsive for a short time. When blood flow to the brain returns to normal, they start to wake up and feel better. Many things can cause someone to faint. For example, standing for too long without moving, especially in hot weather, can lead to fainting. So can standing up too quickly after sitting, squatting, or bending down. Fainting can also happen because of low blood sugar, dehydration, and other medical conditions. Let's say you see a coworker stand up quickly after skipping lunch and sitting at his desk all day. He appears to be dizzy. He may be at risk of fainting, so you should help him sit on a chair or lie face up flat on the floor. Or, if he's already sitting, tell him to bend forward and put his head near his knees. This can help increase blood flow to the brain. Don't let him get up too quickly. Doing so may also cause him to faint. If the person continues to feel dizzy or faints more than once, call 911 and get the first aid kit and an AED if available. But what if your coworker has already fainted and is lying on the floor? Help him onto his back and check to see if he is responsive by tapping and shouting, "Hey, are you okay? Are you okay?" Fainting doesn't typically cause a person to stop breathing, but you should still check. Scan the person's chest for signs of breathing for at least 5, but no more than 10 seconds. Watch to see if their chest rises and falls. If the person is breathing normally, check to see if they were injured when they fell. Provide basic first aid if needed. Do not move the person if you suspect that they have a head or spine injury. If the person begins to respond, have them continue lying down until they feel normal. Then, help them slowly sit up. They should follow up with a healthcare professional. If the person who fainted is unresponsive and not breathing or not breathing normally, start CPR right away and call 911. If the person has been unresponsive for more than 1 minute but is breathing normally, call 911 and stay with them. Now you know how to recognize the signs of fainting and how to give help to someone who needs it.
All right.
Usually when you see people or on television, someone faint, they always fan them and try to cool them off.
You can. I mean, you know, especially if it's heat related, for sure.
Cause I got dizzy yesterday like that, moving too fast, and I had to step outside in the cold to,
Yeah. I mean, you do what you can, whatever, works for you.
How come they don't turn them on the side?
As far as when they fainted, because especially if they saw it happen, they know what's going on. And chances are they're sort of responding. Now, if they weren't responding at all, I would put them in the recovery position. But if I noticed that they just fainted, at that point, either elevate their feet or have them sit on a chair if they're not on the ground, that is. Gravity helps in that type of situation. And you just want to have them just kind of angled towards the ground. So the oxygen to the brain at least flows a little bit better that way, I guess. That's the first time that they incorporate that, which is a little strange for me, but I do understand that. I do the same thing when my son, he, in the summertime, when he gets dehydrated, he gets a little dizzy and he gets a headache, and it's almost like clockwork. It's like, no, you gotta drink some water. You gotta cool down, come here, sit down, lean forward a little bit, and, hydrate, basically. I would say that so much that his summer school teachers would call me hydration mom. I'm like, hey, I teach it, teach first aid. You're gonna hear me. Stay hydrated. All right, diabetes and low blood sugar.
Diabetic emergencies can and do happen anywhere, whether someone is walking a dog, driving a car, or working at the office. 1 in 10 people in the United States has diabetes. Chances are you probably know someone who has diabetes. Diabetes is a disease that affects the levels of sugar in the blood. It also affects how the body processes food and turns it into energy. People with diabetes produce little to no insulin, a hormone that the body uses to lower blood sugar as needed after eating. Blood sugar levels that are too high or too low can cause serious health problems and should be monitored. Testing blood sugar is simple to do with a glucose monitor. Using a standard glucose monitor involves pricking a finger with a needle and testing a small sample of blood. Another way to monitor blood sugar is by using a continuous glucose monitor. This is a sensor placed under the skin that records blood glucose levels continuously. The monitor then sends an alert to a device like a cell phone when levels are too high or too low. A continuous glucose monitor can also be part of an insulin pump, which is a device that some people with diabetes use to take insulin as medication. Insulin pumps are usually attached to the skin on the back of the arm, the upper leg, the hip, the buttock, or the abdomen. Medications and devices can help people with diabetes live normal lives. But what happens when someone's blood sugar drops too low, too fast? A rapid drop in blood sugar could happen because of exercise, or maybe if the person hasn't eaten enough. Vomiting, illness, exposure to extremely hot weather, and too much diabetes medication can also cause someone's blood sugar levels to drop. Hormone changes during puberty can affect glucose levels too. If a person's blood sugar level drops too low, they may become confused, weak, shaky, or sweaty. In more severe cases, they might even have a seizure. That's why it's helpful for people with diabetes to wear medical information jewelry, which can help emergency responders administer the proper treatment when they arrive. Signs of low blood sugar can appear quickly. Here are a few steps you can take if you recognize some of these signs. Let's say your friend with diabetes arrives at the office looking weak and confused after an intense morning workout. First, you should help him sit down slowly if he is standing. If he's responding to you and can sit up and swallow, have him eat or drink something with sugar. This could be glucose tablets, 6 to 8 ounces of fruit juice or regular soda, a tablespoon of honey or table sugar, or 15 to 25 jelly beans or gummy bear type candies. All of these are good for raising blood sugar levels quickly. For people who are awake but don't want to eat something, you can mix sugar and water together and place it either under their tongue or in their cheek. Never force a person who isn't fully awake to eat something because they might choke. If the person doesn't get better within 10 minutes, their blood sugar may be very low. If they can't sit up or swallow, don't force them to eat or drink. Help them sit or lie down and then call 911. And if they are unresponsive and not breathing or not breathing normally, start CPR while you have someone call 911 and get an AED. Now that you know the signs, you're prepared to respond to a low blood sugar emergency.
All right. Again, if somebody has low blood sugar, what should she ask them to eat or drink? Just reiterating.
Juice, gummy bears, jelly
Jelly
beans.
beans.
They got really specific
Sugar.
about that, huh?
Yeah.
15 to 25.
Yes.
I was like, wow, that is like, okay, that's a little bit different from what the last video.
Would you mind if I step out for a minute?
Oh, sure, go ahead. Anyone else need to quickly use the bathroom or anything?
Yeah.
Okay.
What about chocolate?
What about chocolate?
For blood sugar, low blood sugar. Is that okay? Sometimes people
I
just
would-
grab whatever sugar that they can get their hands on.
Pretty much, yeah, that's what I would do. In my opinion, juice is best. It's faster reacting. And it will, yeah, I mean, any really sugary type of juice, in
Yeah.
my opinion, like orange juice. Orange juice is like the big one. But yeah, great question. Depending upon the manufacturer of the chocolate, it might seem there's a lot of sugar, but a lot of the times it's not as much as you think. So I wouldn't go that route per se. I would go with the really sugary items like, things that are completely made of sugar, maybe marshmallows or, gummy bears, jelly beans. But juice would be the number one that I would go to. Or if they had glucose tablets, for sure. They can get sick if they have too much insulin, but more so when becomes a bigger when it's low.
You would think that someone that knows that, been diagnosed as having that would carry some of those things on them, like the glucose.
They do.
Yeah.
They do. Yeah, absolutely. I don't know anyone who doesn't really. Yeah. Or at least makes people very aware. Like if I start freaking out, throw some candy at me. But nowadays there's just so many resources for people. So those, the glucose monitors, blood sugar monitors that they were talking about, they're becoming more and more readily available. And that's just getting better and better.
Technology.
Yeah, technology. But it being available to just anyone in the general public, offering it like for state programs and stuff like that really is becoming better and better. Hopefully that'll just get even better as the years go by. So thank you. Oh, of course. All right. I'm going to hear Courtney's survivor story. We're going to talk about opioid overdose, and we'll talk about naloxone or Narcan, which is the antidote for opioids. They're going to show you how to administer it, I think, if memory serves.
As I was walking to the store, I saw a man who was down in the street just off the sidewalk. I tapped him, but he wasn't conscious. It was an opioid-associated emergency. I lived with addiction. My world became so small, I didn't want help. I was so filled with hatred for myself. So I finally went to rehab, and recovery opened the door. My world now is so much bigger, and I can feel compassion for myself. That day, as I was walking to the store, I saw a man who was down in the street just off the sidewalk. People were frozen and not knowing what to do. I looked around to make sure there were no cars coming, and I moved over to him and helped him onto the sidewalk. I tapped him to see if he was conscious, but he wasn't waking up. I told the people next to me to call 911. Fortunately, I had naloxone in my bag, and I knew what to do. I stayed next to him until the emergency responders arrived. It was important for me to be close to him to feel that he wasn't alone. The ambulance came, they took over from there, and they loaded him up, and I never saw him again. I'm really glad that something like naloxone exists for the public. It's important to educate people about how to use it, what it does, so that we'll remove the fear surrounding it. It's imperative that I help others who feel that pain of isolation. It was so empowering for me to be able to do something. And it was because I had educated myself. In the moment, I just wanted to help him. But in the end, I was helped too.
All right, now we're going to talk about opioid overdose.
You may have heard of the opioid crisis. We use this term to express the severity and scope of this public health issue that affects millions of people and families around the world. Opioid overdose is one of the leading causes of cardiac arrest in young people. In the United States alone, more than 2 million people have an opioid use disorder. It's possible that someone you know may be struggling with a substance use disorder. Your words matter. When referring to an event in which too many opioids were used, some may prefer the terms opioid toxicity, poisoning, or overdose. Choose language that makes them feel safe and comfortable talking to you. This can help reduce the stigma around substance use and encourage them to reach out for help when they need it. Opioids are a highly addictive class of drugs that are usually prescribed for pain relief. Opioids can be prescribed medications such as morphine, codeine, oxycodone, hydrocodone, fentanyl, hydromorphone, and buprenorphine. Opioids such as heroin and fentanyl can also be produced or obtained illegally. Many drugs are mixed with opioids, so someone might take opioids without even knowing. Opioids affect the part of the brain that controls breathing. If someone takes too much of an opioid, their brain's natural drive to breathe is suppressed, which causes their breathing and heart rate to slow down, decreasing oxygen to their brain and other vital organs. This can lead to cardiac arrest and can cause brain damage even before the person's heart has stopped beating. So, how do you know if someone is having an opioid-associated emergency? First, check the scene. Is there any evidence of opioid use nearby, such as syringes, powder, or medication bottles? Has the person vomited? Are they unresponsive or hard to wake? Check to see if the skin is discolored. Are their fingernails or lips blue or gray? Is their skin sweaty? Are the pupils of their eyes very small? Any of these signs can point to an opioid-associated emergency. Naloxone is a life-saving medication that can reverse the effects of an opioid-associated emergency. It's safe to administer even if you're not sure the drug that the person took. It's common to find naloxone in a first aid kit or stored near an AED. You can also get naloxone at a local participating pharmacy. No prescription is needed. Naloxone often comes as a nasal spray or an injectable. The nasal spray makes administering naloxone very simple. To administer naloxone nasal spray, first remove the canister from the box and peel back the tap to open it. Hold the canister with your thumb on the bottom of the plunger and your pointer and middle fingers on either side of the nozzle. Insert the tip of the nozzle into the person's nostril. Now, press and hold the plunger to administer the entire dose. After you've emptied the canister, remove the nozzle from the person's nostril and discard the canister into the trash. If the person doesn't respond within 2 to 3 minutes or if they stop breathing, you might need to give them a second dose of naloxone in the other nostril. Each canister contains only a single dose, so you'll need another canister to give a second dose. But when should you use naloxone? And how should you respond in an opioid-associated emergency? Start by making sure the scene is safe. Check for responsiveness and shout for help. If someone is nearby, tell them to call 911 and get naloxone and an AED if available. If you're alone and don't have a phone, leave to call 911 and get naloxone and an AED if available. Next, check to see if the person is breathing normally. If they are breathing normally, prevent further deterioration by tapping and shouting to keep them awake. Keep their airway open by repositioning their head using the head tilt chin lift maneuver. Give naloxone and continue to monitor their responsiveness and breathing until emergency responders arrive. After you give the first dose of naloxone, tap and shout to keep the person awake. If they are not alert but are still breathing after you give the first dose of naloxone, give a second dose. You can also give a second dose if their breathing slows down or they become less responsive. If they are not responding and not breathing normally, start CPR immediately. It is important to perform cycles of 30 compressions and 2 breaths for a person who has had an opioid-associated emergency. Give naloxone and use an AED if available. Do not delay CPR to give naloxone. Keep performing CPR and using an AED until someone else takes over, emergency responders arrive, or the person starts to respond. If you need to lead the person, put them in the recovery position. To do this, gently turn their head to the left, place their left arm at a right angle to their body, and put their right hand under their left cheek. Then bend their right knee and roll them onto their left side. This position will help prevent choking if they vomit. Once they're in the recovery position, gently open their airway by tilting their head back and lifting their chin. Check to make sure nothing is blocking their airway, and continue to closely monitor the person's breathing and level of responsiveness until medical help arrives. If you know the warning signs, how to administer naloxone, and how to perform CPR, you can help save a life. For more information, visit the Substance Abuse and Mental Health Services Administration National Helpline or call 1-800-662-HELP.
All right, any questions? Moving on.
So you can just go and get
Yeah.
the milk anywhere?
Yep.
Well,
No questions asked.
you just like have it sitting out on the shelf.
No, you would have to request it, from the pharmacist.
Okay.
Yep. Maybe someday it'll be, over the counter, but I doubt it.
Okay.
Just know that there's no known side effects per se. When you do administer it, it doesn't take long to start seeing them starting to wake up. Please know that the reaction is to be very, very agitated. So just make sure you back up, give them enough space. Sometimes they'll come up swinging. All right, we're going to talk about stroke and an acronym for the warning signs. We'll talk about FAST.
A stroke happens when blood stops flowing to a part of the brain or bleeding occurs in the brain, leading to death of brain cells. You might think it happens only to older people, but a stroke could happen to anyone, even to a young colleague at work while they're getting their morning coffee. It's important to be able to recognize the signs of a stroke and be ready to act fast. FAST, or FAST, is a memory aid to help us recall the signs for recognizing a stroke. The letters stand for face, arm, speech, and time. If you think your colleague is having a stroke, use FAST to check for the following signs. F, for face drooping. Does one side of their face droop, or does their face feel numb? Is the person's smile crooked? A, for arm weakness. Is one arm weak or numb? Or can the person not lift their arm at all? S, for speech. Is the person's speech slurred or difficult to understand? Are they unable to speak at all? And finally, if you see any of these signs, or even if the symptoms go away, remember T for time, as in time to call 911 and get them to the hospital immediately. Remember to note the time symptoms started. Other signs of a stroke can include vision changes, such as blurred or double vision, sudden severe headache, which is usually accompanied by some of the other signs of stroke, numbness, usually on one side of the body, and problems with balance. So, now that you can recognize the signs, here are the steps to take if someone is experiencing a stroke. Start by calling 911 and getting an AED if available. If someone else is with you, have them call 911 and get the AED while you stay with the person who is having the stroke. Help the person sit or lie down so that they're not at risk of a fall or injury. Note when the stroke signs first appeared or when the person was last known to be well. This information will help healthcare professionals determine the best treatment. When it comes to strokes, time lost is brain lost. Because treatments are time dependent, it's important that the person receive them as soon as possible. Remain with the person until emergency responders arrive. If the person becomes unresponsive and is not breathing or not breathing normally, start CPR immediately and use the AED as soon as it arrives. By acting quickly, you could save a life and help reduce the damage done to the person's brain, giving them the best chance for a good recovery.
All right. So, face drooping, arm weakness, speech difficulty, time. And they're all pretty sudden. Like you'll be talking to someone and all of a sudden you'll start seeing the side of their face start drooping. And it's a little freaky. But it is, and it's funny because it does happen fast as well. So, all right. Now, what to do for someone who had a seizure or is experiencing a seizure?
A seizure is abnormal electrical activity in the brain that can be caused by a medical condition called epilepsy. Seizures can also be caused by other conditions, such as a head injury, low blood sugar, prolonged heat exposure, poisoning, or cardiac arrest. The seizure could be a one-time event, but seizures can also be recurring, as might be the case for people with epilepsy. Seizures can also look different from person to person. Some people might stiffen and lose consciousness, often losing muscle control and collapsing to the ground. The person's arms and legs might twitch slightly or jerk violently, or their whole body might shake. But not all seizures look like this. Some people might simply stop responding and have a glassy-eyed stare, as if they're daydreaming. For someone having a seizure, the most important first aid action you can take is protecting them from injury. If you can do so safely, gently lower the person to the floor. Move furniture and other objects away from the person. If you can, place something soft under the person's head, like a folded towel or jacket. Never hold them down or put anything in their mouth. This can actually hurt instead of help. Seizures can be scary to witness, but they usually don't last longer than a few minutes. After a seizure, a person might be confused or slow to respond, or even look like they're sleeping. The first thing to do after someone has a seizure is quickly check to see if the person is responsive and breathing. If they are unresponsive and not breathing or not breathing normally, start CPR and send someone to call 911 and get an AED. If they are unresponsive but breathing normally and you don't suspect a head or spine injury, place them in a recovery position so that any fluid or vomit in their mouth won't cause breathing problems. Stay with them until help arrives. Call 911 right away if the person has never had a seizure before, the seizure lasts longer than 5 minutes, or another seizure occurs soon after the first. You'll also want to call 911 if the person has difficulty breathing or staying awake, they were injured during the seizure took place in water, the person has a known health condition like diabetes or heart disease, or the person is pregnant. Now that you know how to recognize and respond to someone having a seizure, you'll be prepared to keep them safe.
Yep, so all you can do is prevent them from getting hurt further, and just let the seizure happen. That is all you can do. Okay, now we're gonna get into bites, stings, heat-related, cold-related, poison emergencies. And then we'll get into the bleeding aspect of the class.
Bites and stings can range from annoying
This is gonna be a
to
lot of
life-threatening.
information.
Given how common they are, it's good to know what steps to take when they happen. As a general rule, you should stay away from animals or insects you don't normally interact with. If something bites or stings you or someone else, be ready to describe it if medical help is needed. If it won't delay treatment and it's safe to do so, take a picture of the animal or insect to show to healthcare professionals. If you or someone near you does get bitten or stung by anything, here's what you should do. Make sure the scene is safe and the animal or insect is no longer a threat. If the person has uncontrolled bleeding at a bite site, shows signs of a severe allergic reaction, or develops breathing problems or symptoms that spread across their body, call 911 right away and get a first aid kit and an AED. Before treating someone's bite or sting wound, put on appropriate PPE. Always try to remove the person's jewelry or restrictive clothing before swelling starts. Then clean the affected area with soap and water and control the bleeding as you would for any wound. Try to keep the wounded part as still as possible. To reduce pain and swelling, apply ice wrapped in a towel to the affected area for up to 20 minutes and provide over-the-counter pain medication. Now that you know the basic first aid steps for treating most bites and stings, let's look at what to do about specific types of bites and stings. Any bite that breaks the skin can become infected. So even if you're bitten by an animal that you know, like your own pet, it's important to treat the wound right away. Clean the injured area and control the bleeding. Call 911 if you cannot control the bleeding or if the bite wound is very large. Animal bites carry the risk of transmitting rabies, which is commonly spread by infected wild animals like raccoons, skunks, foxes, and bats. Rabies is especially prevalent in bats, so anyone who is exposed to one should follow up with a healthcare professional. Rabies-infected animals are often unpredictable and can even infect pets. So if a dog bites you or someone else, ask the owner about their pet's rabies vaccine status and get their contact information. Anytime a bite breaks the skin, whether it's an animal bite or a human bite, you should thoroughly wash the area and follow up with a healthcare professional. Insect, bee, and wasp bites and stings tend to cause mild pain, itching, and local swelling. But they can also cause severe allergic reactions in some people. If a person has a known allergy to insect stings or has trouble breathing, facial swelling, or signs of shock, call 911, get the first aid kit, and get an AED if one is available. Even if you don't see any immediate signs of an allergic reaction, you should still watch the person for at least 30 minutes and be prepared to use an epinephrine autoinjector if they develop a severe allergic reaction. If you're dealing with a bee sting, remove the stinger by scraping the edge of something hard and flat, like a credit card, across the sting site. Just avoid squeezing the venom sac, and be sure to stay clear of any nest or hive in the immediate area. Many people are scared of spiders and scorpions. Luckily, serious problems from their bites and stings are not common. But one thing to remember is that the bites of some venomous spiders and the stings of scorpions can produce local reactions, like a sore that doesn't heal well. And sometimes these bites and stings can make the person sick. A few signs to watch for are severe pain at the site of the bite or sting, muscle cramps, headache, fever, vomiting, breathing problems, seizures, or unresponsiveness. Even though spider bites and scorpion stings are different, the initial first aid treatment for their bites and stings is the same. Here's what you should do. First, follow all the steps that we already covered, including washing the wound and applying ice wrapped in a towel. If the wound worsens or the person develops more symptoms, follow up with a healthcare professional. Call 911 if the person has trouble breathing, the symptoms spread throughout their body, or they become dizzy or confused. If they become unresponsive and stop breathing or stop breathing normally, start CPR and use an AED as soon as one is available. Now for tick bites. I'm sure we can all agree that no one likes ticks. We need to be wary of them because they can carry serious diseases. Ticks tend to be found in grassy and wooded areas. They attach themselves to exposed areas of the body. The longer they are attached, the greater the risk of disease transmission. Never use heat to remove a tick. Instead, use tweezers to grab the tick as close to the skin as you can, and then pull straight out until the skin lifts and the tick lets go. Avoid leaving any parts of the tick's head or mouth under the skin because they could lead to an infection. Once you have the tick, put it in a plastic bag to take with you when seeking medical care. And be sure to wash the affected area well with soap and water. You should follow up with a healthcare professional if the site of the tick bite does not heal, it gets redder and more swollen, the person develops flu-like symptoms, or if you live in an area known for having tick-borne illnesses. When it comes to snakes, only a few species are venomous, with bites that require antivenom. But just in case, you should know the signs of a venomous bite, which can include swelling of the bite area, pain at the bite area that keeps getting worse, and nausea, vomiting, sweating, weakness, or paralysis. Sometimes the ill effects of a snake bite don't appear right away. So the sooner antivenom is administered, if it's needed, the less likely the person will have permanent damage. For any snake bite, make sure the scene is safe, call 911, and get a first aid kit and an AED if one is available. Snake bites can swell quickly, so it's important to remove any jewelry or tight-fitting clothes from the bite area. You should also avoid moving the affected body part. Do not apply ice. Doing so may be harmful. And remember, never pick up or handle the snake, even if it's dead. And never try to suck out the venom or apply tourniquet like they used to in old movies. Finally, while waiting for emergency responders, keep the person as still as possible. Be ready to start CPR and use an AED in case the person becomes unresponsive and stops breathing or stops breathing normally. Finally, we have marine bites and stings. Jellyfish, stingrays, and stonefish can cause toxic bites and stings. These can lead to pain, swelling, redness, and sometimes bleeding or even breathing problems. It's rare, but such bites and stings can be serious or even life-threatening, especially if the person has an allergic reaction. Remember, never handle marine animals with bare hands, even animals that have washed up on the beach and might be dead. When treating a jellyfish sting, use gloves and a towel to remove the tentacles. You can even use seawater to rinse them off. Put the body part that has been stung in hot but not scalding water, or have the person shower for at least 20 minutes or for as long as the pain lasts. If the person has a severe allergic reaction, or if the bite or sting occurred in an area that's known to have venomous marine animals, call 911 immediately. In fact, it's always best to seek medical attention for any bites or stings that break the skin. Finally, remember that some marine animals have toxins that can cause severe allergic reactions, breathing problems, or even paralysis. You should be ready to call 911, start CPR, and use an AED if available. By knowing the signs of bites and stings, understanding what kind of damage they can cause, and following the steps you just learned, you'll be prepared to act in any bite or sting emergency, no matter how big or small.
So at a beach, typically, the lifeguard there will obviously know some first aid steps as well. But if you're just not sure, make sure you call 911. They'll give you some additional steps. So no apple cider vinegar or anything for jellyfish anymore. That's only for one species of jellyfish. I don't know if anyone knew that. It doesn't, and there's many a species. So, yeah. Rinse it off with seawater, and then put said limb in the hottest water that they can stand. That's right. All right. Now we're going to talk about heat-related, cold-related, and poison emergencies.
Heat-related illness can be a problem both at work and in everyday activities. Some people are at higher risk because of their age, health conditions, or working conditions, or because they're not used to hot environments. There are 4 kinds of heat-related illnesses: dehydration, heat cramps, heat exhaustion, and heat stroke. Dehydration occurs when a person doesn't drink enough water or loses fluids through sweating, vomiting, diarrhea, or fever. The person might experience weakness, thirst, dry mouth, chapped lips, dizziness, or less urination than usual. In extreme cases, they might be confused. Say you and a colleague have been working at a factory in heavy gear for several hours. He says he feels lightheaded, and you notice he's sweating a lot. You suspect he's dehydrated. In this situation, where dehydration is brought on by heat, you would move the person to a cool, shaded place to rest. Have them slowly drink water, but if it makes them vomit, they should stop immediately. Don't wait until you are experiencing the effects of dehydration. The best way to prevent dehydration is by drinking fluids before and during activities. If a person is dehydrated for too long, they could develop heat cramps. Heat cramps are painful muscle spasms that often occur in the arms, legs, abdomen, and back. To help someone with heat cramps, have them stop all activity. Move out of the heat, remove extra clothing, place a cool cloth on their skin, drink a sports drink, juice, or water, and gently stretch the cramped muscle. Wrap a bag of ice and water in a towel and apply it to the cramping area for up to 20 minutes. Most heat cramps will get better after you take these steps, but if someone with dehydration or heat cramps doesn't improve, they could develop heat exhaustion. Heat exhaustion symptoms include weakness, fainting, fatigue, muscle cramps, headache, nausea, or vomiting. Now, let's imagine your friend is showing signs of heat exhaustion. Move him to a cool, shaded place. Give him a sports drink, juice, or water, and have him lie down. Next, Remove as much of his clothing as possible and cool him with a cold water spray. Place cool, damp cloths on his neck, armpits, and groin. If he begins to shiver, stop cooling him. And if he doesn't get better, call 911 and get an AED if available. Remember, when it comes to heat-related illnesses, acting promptly is key. Heat exhaustion can quickly lead to something called heat stroke, which is a life-threatening condition. Heat stroke occurs when the body is no longer able to maintain its internal temperature and it begins to rise, affecting the brain. Heat stroke and heat exhaustion have similar signs, but a person experiencing heat stroke will show more serious symptoms like lack of sweating, slurred speech, confusion, agitation, high fever, seizures, or coma. If you suspect that a person is experiencing heat stroke, have someone call 911 and get an AED while you stay with the person. If the person with heat stroke is responding and breathing normally, start cooling them down immediately. Every minute counts. Put them in cool water up to their neck if possible, like in a pool or a bathtub, for up to 15 minutes or until they start acting normally. If you can't do that, spray the person with cool water, just as you would if they had heat exhaustion. Apply ice packs wrapped in towels to their neck, groin, and armpits. If the person starts behaving normally again, stop cooling them, because continuing to cool them could lead to a dangerously low body temperature. But if the person is unresponsive and not breathing or not breathing normally, start CPR immediately and use the AED as soon as it arrives. Note that anyone who experiences heat exhaustion or heat stroke should be seen by a healthcare professional before resuming their normal activities. Remember, stay hydrated, especially when you're in a hot environment. Recognizing the signs of heat-related illness and acting quickly may prevent someone who's experiencing symptoms from getting worse.
And it doesn't take long to be out in the extreme heat for you to start getting dehydrated. Even if you drank 2 bottles of water prior to being out in that heat, it can happen very quickly. Prevention is key. Just try to stay hydrated and know the signs. All right. On the flip side of that, we're going to talk about low body temperature or hypothermia.
Cold-related emergencies like frostbite and hypothermia can set in quickly. While these emergencies most often occur in children and older people, anyone can be severely affected by the cold. Frostbite is a cold injury that occurs when a small, unprotected area of the body freezes due to exposure to an extremely cold environment or substance like dry ice or liquid nitrogen. It most commonly affects fingers, toes, ears, and the nose. Frostbitten skin may appear waxy, pale, or discolored. It may also be cold, numb, or hard, and it will not move if you push on it. Imagine you're out hiking in the snow with a friend who trips and falls hands first into a puddle of icy water. She decides to keep walking, wet gloves and all. After a while, she tells you that she can't feel her fingers. You suspect frostbite. The first thing to do is get to a safe, warm place. It is important to rewarm the frostbitten body part as soon as you can, but only if you are out of the cold. Do not attempt to rewarm a frozen body part if there is a chance of it refreezing. Be gentle with the frozen body part. Do not rub it to warm it up because this might cause more damage. If the person is hypothermic, address the hypothermia before you work to rewarm the frostbitten body part. We'll discuss the treatment for hypothermia in a moment. Remove any wet or tight clothing and pat the skin dry. Keep the person warm. Frostbitten areas will swell during rewarming, so remove any jewelry from the affected area. To rewarm the frostbitten area, put the affected body part in lukewarm, not hot, water. If you don't have access to warm water, let the affected body part warm up by applying body heat or exposing it to warm air. Finally, you can provide over-the-counter medications such as ibuprofen for minor pain and swelling. Remember, anyone who experiences frostbite should follow up with a healthcare professional. Now, let's talk about hypothermia, which can happen even in temperatures above freezing. Hypothermia occurs when a person's body temperature drops significantly due to prolonged exposure to cold, wet conditions. Hypothermia can happen in stages from mild to severe and may lead to death. If someone has mild hypothermia, their skin will be cool or cold to the touch. They may be slow to respond and shiver initially. However, as the hypothermia worsens, the shivering will stop. A person with moderate hypothermia may be confused, behave unusually, or struggle with coordination. They may respond only to loud voices or pain. Their muscles will become stiff and exposed skin will become cold and pale, especially in the hands and feet. A person with severe hypothermia will be unresponsive and will stop shivering. Their heart rate and breathing will slow down and they may go into cardiac arrest. To help someone with mild hypothermia, remove them from the cold environment if possible and rewarm them. Make sure they see a healthcare professional as soon as possible. Let's discuss what to do if the person's symptoms are more severe. Say you're out for a winter hike with a friend. You notice that her skin has become very cold and pale. She is mumbling and stumbling when she walks. She was shivering a few minutes ago, but she is not anymore. These are signs of moderate hypothermia. Your first 2 steps should be to call 911 and get your friend to a safe, warm place. After you move the person to a warm place, remove any wet clothing, pat them dry, and cover them with a blanket or other item to warm them up and prevent further heat loss. If you have a heat source like a fireplace or heater, have the person sit near it for additional heat. Just make sure they don't get burned. If you can't get to a warm place right away and the person is dry, don't remove their clothes. Wrap them in a blanket or thermal foil blanket to keep them from losing any more body heat. Stay with the person until emergency responders arrive. A person with severe hypothermia may become unresponsive and stop breathing or stop breathing normally. If this happens, you'll need to start CPR and use an AED if one is available. You never know when you might encounter a cold-related emergency. You will now be able to help a friend, loved one, or even a stranger in the case of a cold-related emergency.
All right, any questions? Okay. Moving on. So your student manual has awesome additional information that we just don't get a chance to talk about. And so if you're wondering about the steps for certain things, they basically went almost verbatim, especially for the bites portion of it, the stings portion. They pretty much went through that entire section verbatim. So, which is nice. But they do have this, if you, I don't know if you guys see this. Oh, is that how the book comes? Is that how little it is?
Yeah.
Oh, well, that's
Yeah.
different.
Yeah. Yeah. really.
Oh,
Yeah.
now, does it still come with, the little cards? No?
No. Yeah. You got short
We didn't
change.
say the cards.
No, there's no cards.
Okay.
What kind of cards are these supposed to
This
be?
was from 5 years ago, so they probably just don't have them anymore. No big deal. Okay, now, poison emergencies. And knowing where your SDS is, that is if you work with chemicals.
Most people don't expect to be exposed to poison in their daily life, but it's something we should all be aware of because when it happens, you need to react quickly. Poisons are substances that can cause sickness or death when eaten, inhaled, or absorbed through contact with your skin or eyes. Exposure to poisons can happen at home through ingestion, such as when someone takes medication incorrectly. or is exposed to household chemicals. This happens most commonly in children. A disorganized or unsecured medicine cabinet, mislabeled bottles containing chemicals, and other sources can increase the risk of exposure. If someone ingests poison, call 911 right away. Then contact poison control. Call 1-800-222-1222 or visit poisonhealth.org. While you're on the phone with them, poison control will ask what substance the person ingested, and if you can tell, how much. They may also ask for the person's age, weight, and the time since exposure. Finally, they will likely ask for the postal code of where the person is located and their contact information. Stay with the person until emergency responders arrive. Although poison control is a great resource in case of emergencies, prevention is always the safest course of action. It's important to properly label all hazardous substances in your home and keep them stored safely and out of reach of children. Poisoning can also happen in the workplace, such as when someone touches a harmful substance used in manufacturing. If your workplace uses hazardous chemicals, it's important to know what to do if someone is exposed. Find out whether your workplace has a safety officer or a hazardous substance response plan. Only trained personnel should respond to this kind of situation to ensure proper handling and response. If someone is exposed to hazardous chemicals at work, you should immediately make sure the scene is safe and follow your workplace policies. If you don't have a workplace response plan or are unsure what to do, call 911. Generally, there should be hazard signs in work environments to let you know when dangerous substances are present. These can include cabinet markings, door signs, and vehicle placards. Check in with on-site safety personnel for the location of needed documents, including safety data sheets or SDS, and for the appropriate response to emergencies involving chemicals at your place of work. In an emergency, be sure to share any sign or placard information with the emergency dispatcher or poison control personnel. While you're making sure the scene is safe, you should look for spilled or leaking containers, smell for unusual odors, and listen for sounds of escaping gas. If you notice something dangerous and it seems unsafe, evacuate the area and call 911. A chemical spill could affect multiple people, so it's best to stay away to avoid exposure. When you call 911, describe what you saw or experienced while evacuating. If multiple people suddenly become ill in an enclosed space, it could be because of an inhaled poison. If they say they have a headache, fatigue, dizziness, drowsiness, or nausea, they may have been exposed to carbon monoxide, an inhaled poison. You should evacuate the area and call 911. It may be tempting to try and find an antidote, but do this only if instructed to by poison control or the dispatcher. The first aid instructions on the product packaging may be helpful, but they may be incomplete, or you might not know the whole story. That's why it's important to call the experts. Now, let's talk about what to do when someone comes into contact with a harmful substance. You should follow the same basic steps as you would for chemical burns or chemical eye injuries. If you are in a workplace with hazardous substances, follow your workplace policies. First, move the person away from the poison to an area with fresh air if it's safe to do so, and call 911. Avoid getting the substance on yourself. Put on appropriate PPE and then remove all contaminated clothing and equipment. Remove any dry powder or solid substances from the person's skin. Next, take the injured person to a faucet, safety shower, or an eye wash station and run lots of water over the affected areas for at least 15 minutes while you wait for emergency responders. If the person becomes unresponsive and stops breathing or stops breathing normally, start CPR and use an AED as soon as one is available. Use a pocket mask to provide breaths if the substance has touched the person's lips or mouth. Now you can react with the speed that poison emergencies demand, making all the difference when helping someone who has been exposed to a harmful substance.
All right. All right, now we're gonna hear Tony's survivor story. We heard a little bit of it in the beginning. Gonna hear the rest of it and then get into
My friend
external.
told me that when he first saw me, He thought I was dead. I loved my job. My grandfather started in construction. So when I turned 18 years old, I also worked construction. I enjoyed it. I was good at it. I wanted to do it. It was just like family. I usually had one or two coworkers with me. We had one huge pile of dirt. It's been raining for a while, so everything was kind of muddy down there. So chipping away at the side of the mountain there. Next thing I know, I collapsed. The next thing I remember is the sound of the generator was this loud, low hum, and I couldn't move. I was face down under the pile of dirt in excruciating pain because of the force of the dirt. I ruptured two of my discs. My friend yelled for someone to call 911 and then made sure it was safe to go down. As he started removing the dirt, he said he could hear my voice. He found me. He dug me out. He had to get me flat onto that stretcher. And once I was on my back, I needed at least 12 to 15 people to lift me out of there. He saved my life. I still have the scar. That's something that'll never leave. I'm just thankful that he knew exactly what to do. If my friend hadn't been there, I wouldn't be here. If anyone's inclined to learn these life-saving skills, do it, because it's just so important. It literally saves lives.
Okay, so we're gonna get into external bleeding and bleeding control. We're gonna talk about minor bleeding versus severe or life-threatening bleeding and noticing the signs. So we'll talk about how to control bleeding that's minor, obviously. And then noticing whether or not it's minor or severe. Minor being, small amount of blood, easily controlled with pressure and adhesive bandage. But severe life-threatening bleeding is continuous, and it's a steady flow of blood, and loss of large volume, like I think they say 6 ounces, or a half can of soda or more, obviously is expanded. So we're going to talk about all that now. Again, in your manual, they have these steps about controlling minor bleeding versus, severe bleeding as well. And we're going to go through all this here in a little bit, where we're going to pretend that someone has a cut. I'm going to say minor, but they need help getting bandaged up. We're going to talk about some additional things, like packing a wound, tourniquets, if you can't stop the bleeding with time and pressure, and some additional things after that. Any questions so far? Is everybody okay to move on? I know it's a lot of information, I know, but it's good information.
This video contains realistic recreations of first aid emergencies, including images of blood and open wounds that some may find upsetting.
Most of us are familiar with bleeding injuries, whether it's from a small paper cut or something more severe. Hopefully you won't need to respond to a serious bleeding incident, but we're here to prepare you in case you do. Bleeding happens when a blood vessel is cut or torn. It can be external or internal. The most important thing to remember is that applying pressure to an injury can stop bleeding. If you encounter someone who's bleeding, whether it's minor or severe, the first step after making sure the scene is safe is to identify the location and the amount of bleeding. The good news is that you can usually treat minor bleeding from cuts and scrapes with items found in a basic first aid kit. Let's say your colleague cuts her finger on a piece of metal. First, put on clean disposable gloves, and if possible, wash the wound with soap and water. Then, place a dressing such as gauze or a sterile pad on the wound. Apply pressure until the bleeding stops. Finally, put an adhesive bandage or rolled gauze over the dressing to keep it in place. If the bleeding stops, but the injury is deep or gaping, or if it was caused by something dirty, Make sure the injured person gets medical help as soon as possible. They may need stitches or a tetanus shot. An injury that damages a large blood vessel can lead to severe or life-threatening bleeding. Life-threatening bleeding is the loss of 6 ounces of blood or more, which is about half a soda can. Life-threatening bleeding can result from major injuries, like gunshot wounds, or from smaller cuts that seem minor at first, especially if a person is taking certain types of blood-thinning medications like aspirin. If you witness life-threatening bleeding, it's important to stay calm but act quickly. To help you remember what to do, use your ABCs. A for alert, B for bleeding source, and C for control bleeding. Say your colleague had cut herself more deeply and was experiencing life-threatening bleeding. First, check the scene to make sure you and the injured person are safe from whatever caused the bleeding. Then, send someone to get a first aid or bleeding control kit if it's not already available. Then, alert medical help. Next, determine the bleeding source. Where is the person bleeding? Look for the largest source of active bleeding. Now, control the bleeding. Apply pressure. This is the most important step to slow down bleeding. When the first aid kit arrives, put on clean disposable gloves. Then, place the dressing over the wound. Apply direct pressure to the wound by placing the palm of one hand over the dressing. Put your other hand on top of the first hand and press down. Direct pressure should be firm, steady, and constant to stop the bleeding. Do not stop applying pressure to replace the dressing or check on the wound. This can actually cause more bleeding. Your first aid kit might have something called a hemostatic dressing. If so, you should use it. It has a chemical that helps the blood to clot. If the bleeding continues, press harder and keep pressing down firmly until help arrives or the bleeding stops. You can also use a bandage to apply pressure to the wound if you're not physically able to keep pressing down on it until the bleeding stops. If the bleeding stops, you can wrap a bandage tightly over the dressing to hold it in place. But if the bleeding doesn't stop and emergency responders haven't arrived yet, you will need to pack the wound. You can pack a wound anywhere on the body. To demonstrate how to pack the wound, we will use a mannequin arm. Quickly grab more dressing or a clean cloth from your first aid kit and press it tightly into the wound. After you pack the wound, apply direct pressure until help arrives or the bleeding stops. If the injury is located on an arm or a leg, and applying direct pressure and packing the wound hasn't controlled or stopped the bleeding, you'll need to apply a tourniquet. There are many different types of tourniquets, but we'll focus on the most common, the windlass rod type. Homemade or improvised tourniquets are not recommended unless you've had special training. First, place a tourniquet about 3 inches above the area where the arm or leg is bleeding. Never place it on a joint. Instead, go past the joint closer to the person's torso. Next, pull the free end of the tourniquet to make it as tight as possible. Then you can secure it. Finally, twist the windlass until the bleeding stops. This will often cause the injured person a lot of pain, but know that it will slow or even stop blood loss. Secure the windlass and note what time you applied the tourniquet. Emergency responders will ask about it when they arrive. If the tourniquet still doesn't slow or stop the bleeding, you can apply a second tourniquet above the first, closer to the torso and heart. Leave the tourniquets in place until help arrives. Remember that no matter how severe the bleeding and no matter what tools you have, the goal is the same: stop the bleed. Right now, there's a national campaign called Stop the Bleed that encourages lay rescuers to become trained and empowered to help in bleeding emergencies before professional help arrives. The American Heart Association supports Stop the Bleed's efforts to raise awareness on the dangers of blood loss. To learn more, you can visit these websites.
All right. So we're going to partner you guys up, and you're going to stop the bleed. So noting the time when you place the tourniquet, they only have about a 2-hour window before extensive nerve damage can happen, which is why, typically they'll come with a permanent marker. Like they said, 3 inches above the wound. Okay. It used to be 2, but now it's 3. But it'll say time. They want you to write the time right on. Okay. And just like on the video, it's like a belt. Okay. But in this case, you put it on as tight as you can. And then you spin this windlass rod style until you can't anymore. And then there's a little notch. They just put it in there, put the Velcro right on top, and note the time. But they usually come with permanent marker. Right.
And you just had a highlighter to put the date on it. I mean, the time.
Usually you want to use a permanent
No, I'm
marker.
saying for us, you just have a highlight for us, not a permanent one, right?
What do you
But
mean?
write the
Oh,
time
we're
on
not
it.
doing this.
Oh, okay.
Not today. I just wanted to show you. No,
Okay.
today we're gonna have you guys just stop the bleeding with pressure, and we're gonna see that you can appropriately bandage the person. One second. Here we go. Okay, so your partner has cut their forearm on a sharp knife. There's heavy bleeding from the wound. The scene is safe. You have the first aid kit and now are ready to begin. So I need to see all the things. So everything from scene safety, shout for help, have someone call 911, get the AED, all that stuff. You already have the first aid kit, so they don't get the first aid kit. For today, I need you to verbalize you're going to put on your gloves, okay? And then I need to see that you guys can appropriately apply pressure. And if I tell you the bleeding has stopped to or if it didn't stop for that matter, add additional dressings. Now, you typically don't want to take the pressure off. So you want to try to hold that direct pressure on the wound. But you kind of want to slide the dressing in until the bleeding stops. And then you want to put the bandage on then once it does. Okay. Eugenia, if you wouldn't mind to demonstrate on me controlling bleeding and bandaging, and then you two are just going to bandage each other. Okay. Now I need to see scene is safe, gloves on. And you come up to me and I'm gonna help you now, sir, man, whatever. Partner, I think they said. And then apply pressure. Okay. And I mean apply pressure. All right. Once if I tell you the bleeding stopped, then appropriately bandage it. Even let the person know if it feels good, if it's too tight, that type of thing. All right, here you go. Okay. So, I got a cut of my arm. I need help. Perfect.
What
Yeah.
about if you're not resting on anything? Do you still use both hands?
I would put one under.
Yeah, so
That's
just do
what
this.
I would.
Okay. Okay, how does this feel? Is this okay?
Good. And then has the bleeding stopped? Yes, it stopped.
Okay.
You can't lift it up.
Oh, shoot.
Good for me to know.
Dang it.
Just kind of peek.
Okay.
Okay, the bleeding stopped. Okay, so here we go. And even
Now what
ask
do?
them, I would even ask them to hold on to it.
Oh, okay.
Okay.
You know,
Okay. Hold on to it as I wrap it.
okay. Perfect.
Do you want me to finish it or?
Yeah, I mean, okay, well. Oh, that feels good.
Good.
Nice and sturdy,
There we go.
Yeah, and then you obviously tuck it. Yeah, you got it. Great job.
Now, do I want to be tight when I'm wrapping it, or it's okay to be loose with it?
It's like in the middle.
Okay, in
You
the
want,
middle,
you
okay.
don't want it to be too loose, but you
Okay.
don't want it to be too tight where you're gonna,
Okay,
cut
okay.
out their circulation. Great question. Okay, so what are you two gonna do first before you approach?
And I put my glove, oh,
yeah.
yeah, put my gloves on.
Oh, I thought you said that. You didn't say
And then I
that?
want to check to see if the scene is safe.
Gloves on first.
Oh.
Oh, it always asks me if I want to stay in the call. Here we go. Okay. Yep, gloves on. Okay, we'll pretend that your gloves are on. I'm sorry, I'm trying to do this in a timely manner. It's not working. All right. We're going to bandage her first.
Okay.
Okay. Cena safe.
Put gloves on, single safe,
Okay, gloves on.
gloves on,
Okay.
but I still call for help.
Of course. Yeah,
Call for help,
absolutely.
help,
Mhm.
you know,
But you
so-
have your first aid kit.
right,
Okay. All right.
okay. The blood is here, put
Yep.
it on tight, you know,
Okay. Perfect. It's been about 15 seconds. Let's say the bleeding has stopped.
okay, bleeding stop, then I'm gonna roll this
Okay.
on here.
Okay. Yeah, don't be afraid to ask the person to hold the bandage to help you.
Okay.
You know what I mean?
Can you hold that?
No.
Hold the push down tight,
Because it's their blood. If you think
Yeah.
about it, you know.
hold it tight, we wanna make sure it stays stopped.
And you always note the time, any first aid. It's always kind of the go-to. Always note the time. All right, so how does that feel?
Good.
Good?
Tight, yeah,
Yeah?
yeah,
Good.
nice and
The
tight.
time is 11:20,
Okay.
you know, right there.
Exactly.
Yeah.
Well, you would write that on the tourniquet, yes,
Yeah.
but
Oh,
you do want to note it.
Yeah.
to
okay,
let paramedics know when you did,
okay.
if it's more severe. All right, if you wouldn't mind unraveling that, and now I need to see that,
Okay,
stopping the bleeding.
okay. I'm gonna put my, okay. I'm gonna put my gloves on.
Okay,
I'm gonna check to see if the scene is safe.
yep, Cena, see.
Oh, then I have, I'll just call for help, someone to
Right.
call 911.
Right, right.
And, Harry,
And-
mister.
And your husband has a pretty, I mean, it's not life-threatening yet,
Yeah,
okay, but he's got a bad cut on his arm and he
Yeah.
needs help,
yeah,
okay?
so I'm gonna hold the side.
Okay. All right, let's see if the bleeding stopped.
No. it hasn't stopped.
Okay,
There
hasn't
you
stopped.
go.
Okay, well,
Okay,
you want to
it
hold
hasn't
on,
stopped.
all right?
Yeah, come on. Can you hold this for me, please?
Okay.
Got it? Got it. Got it tight.
Okay. Okay, how does that feel? Good?
Okay.
Good. All right, thank you. You guys passed that portion of it. And again, severe bleeding. What they don't tell you, okay? If you have to pack a wound, it doesn't feel good, okay? You're gonna need help holding the person down, okay? It's gonna be excruciating. Chances are they'll probably pass out. Just prepare yourself, okay? It's, you know, it's not an easy thing to do, packing a wound. But once you do pack that wound, and you apply pressure, and it stops bleeding, again, that tourniquet, if it's on a limb, otherwise, if it's somewhere like on the stomach and you can't apply a tourniquet, do what you can until that advanced help arrives. Any questions? And then remember, 3 inches above the wound. And if it doesn't stop the bleeding, you can, if you have another tourniquet, you can put another one on. I always say closer to the heart. But they say closer to the torso, so same thing.
And what if there's shrapnel in there?
Shrapnel, that is a great question. Use your best judgment. If you know it's gonna probably cause some damage if you apply that pressure. Most first aid kits have,
Tweezers.
thank you, tweezers, where you can at least pick the big parts out. I wouldn't be too picky about it, especially if there's severe bleeding,
Mhm.
but just be mindful of that. Just use your best judgment. This is all, use your best judgment and do what you can to help that person. If they are, coherent, ask them if you can help them as well, because they have the right to refuse.
We didn't see it done on her, did we?
What?
The wrapping on the bandage. Did you do it on her?
No, I don't have to, because I'm not being tested. Thank you for that. Okay.
I think in the book also it said don't remove anything.
You
Just
don't.
in case it,
You don't.
like, gush out the blood or.
Yes,
Yeah.
absolutely. You don't want to relieve pressure. So they really want you to determine the blood loss, the blood loss amount. Say that 5 times in a row. Prior to helping, they really want you to determine that before you go ahead and apply that pressure.
But if you leave it in there and you're trying to put pressure on it though, that's gonna hurt too.
Of course it is.
Yeah.
Yep. You're trying to stop it, if you think you can stop the bleeding with a little bit more of, the dressing in time, sneak it in there. Just sneak it in there. That's what I would do. Try to not relieve pressure as much as possible, but use your best judgment, and a lot of the times use what you got, I don't know if you guys saw that in your book, but they've got a really great list of first aid kits and what you should have in it.
Yes.
And adding that book, which is why I'm guessing it's littler.
Yeah.
Well, it just clicked for me. It's also a great addition to put in a first aid kit.
Yes.
Yeah, it said that too.
Yeah, absolutely. 100%. Did they say that? That's great.
Yes.
All right. Cool. Any other questions? You guys have great questions.
Yeah, if a blood vessel break,
Oh, that's a whole different ballgame.
Oh,
That's a whole different ballgame. We're just
I'm saying, but
helping stop the bleeding. Now that,
right. That's
you
what I'm
know.
saying. If it get cut, you cut a vessel, right?
so, you mean an artery? Are you talking about an artery? Like if you,
Well, the blood.
where it would not stop, like it's squirting
yeah.
type thing? So that's also severe bleeding. So that's severe in my eyes. Okay, if it's continuous flow, okay, or squirting. I wouldn't even delay. I would probably slap that tourniquet on as fast as I could. Probably trying to stop the bleeding at the same time. But that's just me. Less of a delay for anything when it comes to first aid. In my eyes. So again, they want us to try to determine that prior to helping. And it wouldn't be a bad idea. Yeah, I would apply that tourniquet and peck the wound and stop the bleeding probably at the same time. Yeah, that's my opinion, and I'm sticking to it. But again, so maybe it's circumstantial. You never know. Don't know what the situation is, and use your best judgment. Okay, great job. Let's see if we did well. I don't know if they replay the video.
This video contains realistic recreations of first aid emergencies, including images of blood and open wounds that some may find upsetting.
Okay.
Let's practice how to control life-threatening bleeding by applying pressure. First, put on clean, disposable gloves. Identify the presence and location of the bleeding. Did you find it? Okay. Now we need to apply a gauze dressing or a sterile pad to the injured area. Place the dressing directly on the wound. Now apply direct pressure by placing the palm of one hand over the dressing. Now put the other hand on top of the first hand and press down. Try to keep your arms straight and elbows locked as you press. It looks like it's still bleeding. We need to add more dressing to the wound.
I need that arm.
Place this new dressing on top of the first one. Do not remove blood-soaked dressings.
How do you
Apply
see that?
pressure.
Okay. So you have to.
It seems like the bleeding has stopped. To finish, put an adhesive bandage or rolled gauze over the dressing to keep it in place. Great job.
For the record, it did not look like that. Okay. So the reason why I didn't do it with the video is because obviously he has a better, a nice little arm there that is providing a flow of blood. And it just it wouldn't have been flowed very good when you guys did it. So I did want you to watch it, to see, how it goes though. All right, now we're going to talk about some additional wounds, like if something, gets stuck in the eye, if you hit your nose, wounds to the mouth, losing teeth, penetrating, puncturing injuries, amputation, what to do for an amputated body part, internal bleeding, and what can happen with shock, head, neck, spine injuries, broken bones, sprains, burns, electrical injuries, preventing, what is this, repetitive stress injuries? Is that what it is? Oh my goodness. Recognizing signs of mental health. Oh, wow. Okay. And then we'll conclude, go on a break, come back here at approximately noon. I hope we can get through all this. Let's get to it. Still a lot of
Injuries to the eyes and nose can be alarming, but prompt first aid can improve the outcome for the injured person. Before you help an injured person, check that the scene is safe and get a first aid kit and proper PPE. If someone is with you, ask them to get these items while you stay with the injured person. Let's say one of your coworkers got hit in the face with a board while operating a table saw. To be sure the scene is safe, you should check that the machinery is powered off before approaching the person. Assess the location and severity of the injury. For a nose injury, control the bleeding by having the injured person sit down and lean forward. They should not lean backward. This can cause the blood to drain down the person's throat, which can lead to vomiting. Using a clean dressing, pinch both sides of the nose and apply pressure for at least 10 minutes. If the bleeding continues, increase the pressure. Call 911 if the bleeding doesn't stop after 15 minutes. The bleeding is heavy, such as if there's gushing or spurting. The person has a possible head injury, nose fractures, or facial fractures. The person has trouble breathing. The person feels dizzy or lightheaded. Or the person is on blood thinners, such as aspirin, or has a condition that causes them to bleed more than most people. Now, let's say your coworker got some sawdust in his eye while working. For an eye injury, look to see if there is redness, swelling, bruising, or bleeding. If the eye has been punctured, or if the person is in extreme pain or has vision loss, call 911 and have the injured person keep their eyes closed until emergency responders arrive. If there's a foreign object in the eyes, such as sand or dirt, rinse the person's eyes with tap water. Don't let the person rub their eyes because this may cause further damage. If the person wears contact lenses, remove them. If you're treating a chemical eye injury, rinse the injured person's eyes with tap water for at least 15 minutes or until emergency responders arrive, unless otherwise recommended. If there's an eye wash station or kit available, use it. If not, a saline solution, such as contact solution, works well to rinse eyes. Otherwise, use a hose, faucet, or any other source of clean water to rinse the eyes. If only one eye is affected, position that eye lower than the other eye while you rinse. Otherwise, you might accidentally wash the contaminant from the injured eye into the unaffected eye and worsen the injury. Contact poison control at 1-800-222-1222 or call 911 if you're helping someone with a chemical eye injury and you're unsure what to do. Make sure the injured person sees a healthcare professional as soon as possible. Now you have the skills you need to help someone with a nose injury or an eye injury.
All right, we're gonna just keep going here.
Mouth and tooth injuries are common. Injuries to the mouth can bleed a lot, and seeing someone break or lose a tooth can seem scary. But being prepared will help you react with confidence. Imagine you're playing tag with a child when she trips and falls. She hits her mouth and it starts to bleed. First, look around and make sure the scene is safe. Then, designate someone to get a first aid kit. Be sure to use appropriate PPE if it's available. Next, locate the wound and control the bleeding by applying pressure. If the bleeding is from the tongue, lip, or cheek, and you can reach the wound, apply pressure with gauze or a clean cloth. In many cases, these steps will be enough. But if the bleeding does not stop within 10 minutes or if the person has trouble breathing, call 911. Sometimes when a person has a mouth injury, one or more teeth may be broken, loosened, or even knocked out. This can be a choking hazard. Check the person's mouth for any missing, broken, or loose teeth. If you see that a tooth is chipped, gently clean the injured area. If a tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place. In both instances, make sure to contact a dentist. If a tooth has come out, the following steps can increase the chance that a dentist could save the tooth. First, hold the tooth by the crown or top using your gloved hand. Never hold a tooth by the root. Remove any visible debris by rinsing the tooth with saline solution or clean water for less than 10 seconds. Then apply pressure with gauze to stop any bleeding in the empty tooth socket. Next, clean the area where the tooth was with saline solution or clean water. Gently place the tooth back into its socket. Then have the person gently bite down on a piece of gauze to help hold the tooth in place. Other options for storing the tooth are putting it in an oral rehydration salt solution, cow's milk, or the injured person's own saliva, or you can wrap it tightly in plastic wrap. Finally, take the injured person and their tooth to a dentist or the emergency department immediately. If you follow these steps, you can smile, knowing there's a better chance the dentist can save the permanent tooth thanks to your confident action.
All right, penetrating and puncturing injuries.
Let's take a few moments to discuss how to treat penetrating and puncturing injuries. These injuries happen when knives, nails, construction materials, or other sharp objects puncture the skin. Sometimes something can even penetrate part of the body and remain there. Imagine you're on the job and you see a nail go through a coworker's hand. Of course, that would be shocking to anyone, but you don't need to be a healthcare professional to help. First, remain calm. Look around to make sure the scene is safe for both you and the person you're helping. If there's any machinery or equipment running near you that could still cause danger, turn it off. Because all penetrating injuries have the potential to cause internal bleeding, call 911 and get a first aid kit and an AED if available. Keep the person still. And be sure to use gloves. Control any bleeding until emergency responders arrive. Leave the object in place. Never remove an object that's still stuck in a person's body. Doing this can cause more damage and increase bleeding. To control the bleeding around the object, in this case the nail, apply a clean dressing around the object and apply pressure to the wound. Avoid pressing directly on the object. It's important to note that if this wound were on a larger part of the body, like the torso or upper leg, the bleeding could be more severe inside the person's body, where you might not be able to see it. If the person becomes unresponsive and stops breathing or stops breathing normally, start CPR and use an AED as soon as it's available. By following these steps, you'll make sure the injured person is in the best possible condition when emergency responders arrive.
I know it sounds crazy, but that object that's in place is actually preventing it from, I guess, worse bleeding until they can get them to the hospital where they are very equipped to handle that type of bleeding. Now we're going to talk about amputation.
This video contains realistic recreations of first aid emergencies, including images of blood and open wounds that some may find upsetting.
Every job comes with its own risks, some more dangerous than others. Amputation is a possible workplace risk. If you ever encounter an amputation emergency, whether you're on the job or not, there are steps you can take to help the person in need. An amputation is when a part of the body is cut or torn off. Amputation can be traumatic and must be treated immediately. Imagine you work beside a coworker who operates a circular saw. Their thumb slips under the blade and gets cut off. What do you do? First, make sure that the scene is safe. Shut down any machinery that might pose a danger to you, the injured person, and others. Shout for help and send someone to call 911 and get a first aid kit, an AED, and get a bleeding control kit if available. Be sure to put on PPE if you have it. There will likely be a lot of blood, but stay calm. You'll need to control the bleeding with direct pressure and possibly a tourniquet. It's important to control the bleeding before turning your attention to the amputated body part. Once the bleeding is under control, safely retrieve the amputated body part if possible. Quick action can improve the chances of reattachment at the hospital. Then, with your gloves on, follow these steps. Rinse the amputated body part with clean water to remove dirt and debris. Pat it dry. Wrap it loosely with a clean, damp dressing and place it in a clean, watertight bag. Write the name of the injured person, the date, and the time on the bag. Then place the sealed bag in a container filled with ice and water. This protects the amputated part from freezing. Never place the part directly in ice or water. And finally, make sure the amputated body part makes it to the hospital with the injured person. Follow these steps and you can significantly improve the person's chances of reattachment and recovery after an amputation.
All right, internal bleeding and shock.
We often hear about internal bleeding in TV dramas or movies, but it also happens in real life. Internal bleeding occurs when someone's blood vessels or organs are damaged and blood collects inside their body, usually after a severe injury. Internal bleeding can be caused by blunt force trauma, like being struck on the torso with a baseball bat, or it can be caused by penetrating trauma, such as a gunshot wound or being impaled by a sharp object. Penetrating wounds can be especially concerning because they can cause internal bleeding along with the external wounds. Suspect internal bleeding if a person has experienced something like a car crash, a fall from a height, or a high impact sports injury, or if they have been hit by an object that's traveling at high speed. Note that people who take blood thinning medications are at higher risk for internal bleeding after injuries like these. Now, internal bleeding may have no obvious visible signs. However, there are a few things you should still look out for, including injuries to or pain in the person's abdomen or chest, bruises on the body, such as from a seatbelt or handlebars, lightheadedness, shortness of breath, restlessness, and coughing up or vomiting blood. Symptoms of shock might also appear, like rapid heartbeat, confusion, lightheadedness, or pale, cool, or sweaty skin. Shock is when the body's organs do not receive enough blood or oxygen to function properly. This life-threatening condition can be caused by severe infections, allergic reactions, heart problems, or severe bleeding. Shock needs to be treated immediately by healthcare professionals. Imagine a scenario in which an office employee experiences blunt force trauma to the stomach. This could happen for various reasons, such as a fall or an unexpected impact with heavy equipment. She looks pale and sweaty, as she says she has severe pain in her abdomen and feels lightheaded. This person may have internal bleeding and could also be in shock. To treat her, first make sure the scene is safe. Then check for responsiveness. Next, call 911 and send someone to get a first aid kit and an AED. Make sure she is breathing normally. If the injured person is responding and is breathing normally, help them lie down and keep them still to prevent further injury. Keep the person warm. And if they have no back or other injuries that would cause pain, help them place their feet on something that's about 6 to 12 inches off the floor. If the person is breathing normally but shows decreased responsiveness or is vomiting, or if you need to leave them to go call 911, place them in the recovery position. Always wear gloves and other PPE while treating any external injuries. Stay with the person until emergency responders arrive. If the person becomes unresponsive and stops breathing or stops breathing normally, start CPR and use an AED. Emergency responders are on the way, but until they arrive, the skills you just learned may help save the life of someone who has symptoms of internal bleeding or shock.
All right, we gotta keep going here.
Injuries to the head, neck, and spine can be serious, which is why it's important to stay calm and take the proper first aid steps. Let's start with first aid for head injuries, which can have many possible causes, including a fall from a height, a blow to the head, or auto or bike accidents, especially if the person's not wearing a helmet. Some head injuries can cause a concussion, which is what happens when the head or body is hit so hard that the brain moves forcibly inside the skull, potentially damaging the brain. Let's say you're walking with a friend who slips on a wet floor, smacking her head hard. You're worried she might have a concussion. Here are some signs you would want to look out for. Someone with a concussion may appear stunned or confused, and they may not remember what happened. They might be dizzy, have a headache, be unusually forgetful. They might also feel nauseous, start vomiting, have trouble seeing or moving their body, feel sensitive to light and noise, and even show slight changes in personality. Finally, having a seizure or becoming unresponsive are also warning signs of a severe head injury. These signs can come and go, be constant, or get worse as time goes on. Concussions can look different every time. Symptoms might not appear for hours or even days, which makes them especially dangerous. They are more common in children, teenagers, and older adults, but they can happen to anyone. If you suspect a concussion, have the person stop all activity. Some head injuries might seem to improve for a short while, but then get rapidly worse. You don't want to take a risk of a second impact before the first injury has fully healed, because a second impact could lead to permanent damage or even death. Have them see a healthcare professional for evaluation. It's important that the person does not resume any physical activities until they're given the go-ahead by a healthcare professional. If the person's symptoms get worse or they become unresponsive, call 911 and be prepared to start CPR. Neck and spine injuries can often occur along with a head injury or result from similar causes. As with head injuries, neck and spine injuries can look different with each person and each injury. Some common signs are tingling, numbness, or weakness in the person's arms or legs, pain in their head, neck, or back, or being unable to move a part of their body. Head injuries can sometimes prevent someone from telling you about their symptoms. If you suspect that a person has a head, neck, or spine injury, it's critical that they stop all physical activity until they've been seen by a healthcare professional. Let's look at the correct steps to take for spine injuries. As in any first aid emergency, make sure the scene is safe and send someone to call 911 and get a first aid kit and an AED. Remember to use appropriate PPE if you have it. Keep the person still and don't move them unless they are in danger, are vomiting, or at risk of choking or need CPR. If you have to move the person, avoid twisting their head or neck to prevent any further damage. Have someone help you if possible. Carefully roll the person, making sure to keep their head, neck, and spine aligned. And remember, if the person is unresponsive and is not breathing or not breathing normally, start CPR and use an AED right away if available. After a head or spine injury, it's important for the person to avoid operating heavy machinery, playing sports, and driving until they've been seen by a healthcare professional. These injuries can easily be made worse by further movement. Now that you know what to do, including how to move someone safely in case of a head, neck, or spine injury, you are better prepared to respond if someone gets hurt.
All right. Broken bones and sprains.
Most likely, you will encounter a broken bone or sprain at some point in your life, whether the injury happens to you or someone you know. A fracture is a break in a bone. A sprain is when you stretch or completely tear a ligament, which is a thick, tough tissue that connects two bones. Without a physical exam or x-ray, it's hard to tell the difference between a broken bone and a sprain. The good news is, we treat them the same way. Picture this. You're at work and your coworker trips and lands on his arm. You hear a snap, a cry of pain. His arm looks swollen and bruised. Start by making sure the scene is safe and shout for help. If the injury is severe enough, such as if a bone is protruding through the skin or there's heavy bleeding, call 911 right away. An injury like this may be hard to look at, but stay calm. Get a first aid kit as soon as possible and use any available PPE. It's critical that you keep the person's injured body part still. Do not try to bend or move it. In the case of severe bleeding, control the bleeding by applying pressure to the wound. Cover the injury with a clean towel. Then apply ice on top of the towel. In the case of a severe injury, keep the injured body part still until emergency responders arrive. In the case of a less severe injury, you can splint the injury yourself. There are a few general rules for splinting an injury. If you need to move the person, splint the injury before you do. This will protect the injured body part from further injury. Do not try to straighten the injured body part. Always try to splint it in the position you found it. To make sure the injured part doesn't move or bend, make the splint longer than the injury and long enough to support and immobilize the joints above and below. To make a splint, you first need materials. Look around the area for rigid, supportive materials, such as a piece of wood. If there are no materials available, you can splint the body part against the rest of the body. Adjust the splinting material to the correct length and pad any hard surfaces. Once the splinting material is the correct length, find tape, gauze, or another material that can be used to secure. Control any bleeding as needed. Apply the splint. Make sure it's secure with a bandage or tape. The splint should be snug, but not too tight, so that it is secure but doesn't cut off circulation. If the area below the splint gets numb, cold, or discolored, loosen the splint. No matter how good your splinting skills are, it's important to have the injured person seen by a healthcare professional. There you have it. You can now jump into action if you witness an injury that involves a broken bone or a sprain.
Now, burns, electrical injury. Then we'll talk about some preventative measures and conclude this section.
Burns and electrical injuries can happen to anyone. There are 3 common types of burns: heat, electrical, and chemical. It's important to know how to respond to each type. The first step you should take for any kind of burn is to make sure the scene is safe for you and the injured person. Then get a first aid kit and put on appropriate PPE. If needed, call 911. Heat burns can be caused by exposure to fire, hot liquids, steam, and even the sun. Let's say you're with someone who burns his finger on a hot kettle. For small heat burns, run cold water over the burn for at least 5 minutes. Then apply a dry, clean dressing. If available, apply antibiotic ointment or petroleum jelly to the burn and provide over-the-counter pain medications for minor pain control. See a healthcare professional as soon as possible. Larger burns are treated in a similar way. Just remember to stay very aware of your surroundings. If the person is on fire, have them stop, drop, and roll, then immediately cover them with a wet blanket. If you can, remove jewelry or clothing from the burn area that isn't stuck to the skin. Next, cool the burn with cold water for at least 5 minutes. After cooling, cover the burn with a dry, clean dressing and cover the person with a dry blanket to help prevent shock. Any burn that is larger than the palm of the hand or that is on the face, hands, feet, or genitalia will need to be evaluated as soon as possible by a healthcare professional. Finally, if the person is in severe pain or having difficulty breathing, or if the burn is very large, get an AED if available and stay with the person until emergency responders arrive. In the case of severe burns, the body loses its ability to maintain a normal temperature, which could lead to hypothermia during cooling. Stop cooling the person if they become cold, start to shiver, or become drowsy. Electrical burns require a few additional steps. This is because the electrical current passes through the body, which can lead to severe external and internal damage, and even cardiac arrest. Now, let's say someone at work receives a burn while trying to fix a switch. We always want to check for scene safety during an emergency. The hazard may not be apparent initially, so approach with extreme caution. Make sure the power is turned off before approaching the affected person or touching any wires. Call 911 right away and get a first aid kit and an AED. The next step is critical. You need to evaluate if the injured person needs CPR. If the person is responsive and breathing, stay with them until emergency responders arrive. If they are unresponsive and not breathing or not breathing normally, start CPR and use an AED as soon as it's available. Even if CPR is not needed, the person should still be evaluated by a healthcare professional. Last, we have chemical burns. Chemical burns happen when your skin or eyes come into contact with an irritant. This can affect you both externally and internally if ingested. Businesses that work with chemicals have safety data sheets, or SDS, which help responders properly treat someone who's been exposed to chemicals. Contact on-site safety personnel to determine the chemicals involved, as well as proper response. When someone has a chemical burn, start by checking that the scene is safe, calling 911 and getting a first aid kit and an AED. After you call 911, you can contact Poison Control at 1-800-222-1222 or visit poisonhelp.org. Next, use appropriate PPE and remove all contaminated clothing and equipment, being careful not to get the chemical on yourself. Unless otherwise recommended, flush the injured area with running water for at least 15 minutes. Last, cover the burn with a dry, clean dressing and bandage loosely. Make sure to follow up with a healthcare professional. And that's everything. Now you can safely respond and help anyone with a heat, electrical, or chemical burn.
Okay. Now we're getting to the preventative portion here.
Many companies are using ergonomics in the workplace to improve both safety and comfort for their employees. Ergonomics is the study of efficiency and safety in people's work environments. By applying the principles of ergonomics, companies are helping to protect their employees from job-related musculoskeletal disorders, or MSDs, also known as soft tissue injuries. Factors such as work position, how frequently you perform a task, how much effort you exert, and how long a task takes all impact your risk for developing an MSD. A specific risk for developing an MSD includes excessive force. That's when you lift heavy objects, move heavy loads by pushing or pulling, or use tools that require significant physical effort. Repetitive tasks, another risk factor of MSDs, are when you perform the same motion repeatedly or frequently over a long period of time, which can strain your muscles and joints. Awkward postures such as kneeling, squatting, leaning over, and reaching above shoulder height can also place undue stress on your body. Another risk factor is localized pressure, which includes using your hand as a tool, like when kneading dough or pressing parts of your body against hard surfaces. Cold temperatures, such as in industries like meatpacking, can place added strain on your muscles and joints, making them more susceptible to injury. Vibration is also a risk. Both whole body and hand-arm vibration, like when you're using power tools, can damage blood vessels and nerves, affecting your control of hand tools and increasing the force that you must exert. Finally, in some workplaces, there can be combined risks. This is a significant concern because exposure to multiple risk factors at the same time can increase your chances of injury. Many employers put controls in place to help reduce these risks. For example, let's say you work in a warehouse and perform the same repetitive motions day after day, bending and lifting boxes of inventory onto shelves, many of which are higher than your shoulders. To ensure your health and safety, your employer might implement engineering controls. These involve physical modifications to the workplace, like using lifting devices, reducing load weight, adjusting work tables, or optimizing conveyor systems. These things all help minimize repetitive tasks and awkward positions. Or your employer might implement what we call administrative and work practice controls. These measures establish efficient processes, such as requiring that heavy loads be lifted by 2 people, rotating employees between tasks to prevent continuous strain, scheduling regular breaks, ensuring the proper use and maintenance of tools and equipment, and having desks set up for each person's particular task and body. At work, Using job-specific PPE can help protect you from hazards beyond infections or chemicals. For example, PPE such as hard hats, ear protection, well-fitting thermal gloves, and padding that reduces direct contact with hard surfaces can help decrease your risk of injury. If you do develop pain or other symptoms related to your work, report them to your employer and follow up with a healthcare professional. Don't ignore the symptoms. Addressing them early can help reduce the amount of time your body will need to heal.
Finally, recognizing signs of mental health crisis in the workplace.
When you think of the workplace, you might picture a long to-do list, equipment, meetings, or maybe even an annual holiday party. One workplace component that people don't tend to talk about as much is mental health, which is very important. Situations that arise in and out of the workplace can sometimes increase the risk of mental health challenges. Someone who is struggling with their mental health might find it difficult to complete common tasks, have reduced productivity, experience decreased levels of happiness and well-being, and feel burned out. Stress can affect a person mentally and physically. Stress might take forms like headaches, back pain, stomach pain, decreased energy, or sleep changes that might appear as irritability, forgetfulness, or a loss of control. Stressful situations set off a chain of events within your body. In response to a stressful event, your body releases hormones that temporarily cause your breathing and heart rate to spike and your blood pressure to rise. If left unchecked, feelings of stress can progress into chronic stress. That's when stress feels constant and the body is in high gear on and off for days or even weeks at a time, causing high blood pressure and increased risks of heart attack, stroke, and other long-term health problems. Chronic stress can also lead to mental health problems. In some extreme cases, it could even lead to suicidal thoughts or violence in the workplace. It's a good idea to be aware of warning signs of chronic stress affecting someone's mental health. These signs include withdrawal and a drop in functioning, reckless behavior, mood changes, problems thinking or concentrating, performance changes, and increased use or abuse of substances like alcohol. If you suspect a coworker might be struggling with their mental health, you should ask them if they're experiencing any of these symptoms or difficulties. Listen to them non-judgmentally. Encourage them to seek appropriate professional help. Encourage self-help behaviors and offer them reassurance. Most importantly, remember that it's okay if someone has mental health challenges. Asking someone if they're struggling or if they might be suicidal can help the person feel less alone and more supported. If you are feeling any of these symptoms, reach out for help. Available resources may include employee assistance programs, health initiatives provided through health insurance, and occupational medicine providers. If you or someone else is in distress, consider contacting 988, the Suicide and Crisis Lifeline. Using these resources can help you manage your stress and mental health. Be sure to periodically check in with yourself and your colleagues, because it's normal to experience challenges, and you can never truly know what someone else is going through.
Solid advice. All right. We are going to conclude, and then we're going to take just a quick.
I'm really glad
Quick
that
5-minute
something
break
like
here.
naloxone exists for the public, and it's important to educate people about how to use it, what it does, so that it will remove the fear surrounding it.
Bringing our daughter into this world, she's the light of our lives. She's a miracle. I wouldn't be here without CPR. Our family wouldn't be what it is without CPR.
Because I had been trained, I was able to just go into muscle memory and do what I had been trained to do. Early intervention is the key. We probably would have had a different outcome.
I was thankful that she was able to call 911. So she was wise and smart in that way. It's so important to know all of these things. And I'm just glad that I had the opportunity to learn all of these things for myself and to be able to encourage others to make sure you do it.
My parents care for me, look out for me. I know I need to stay strong in order to have them stay strong. You want to be optimistic about the situation. What I'm excited for, I'm just looking forward to like seeing what life gives me and how I'll tackle the problems, you know?
By learning the skills in this course, you've prepared yourself to respond with confidence to an emergency. Now you can give life-saving help that many ill or injured people so desperately need.
Thanks to your participation in this Heartsaver course, you can join the American Heart Association in its mission to be a relentless force for a world of longer, healthier lives.
The survivors you've heard from are all alive today thanks to the quick thinking and confident actions of loved ones, coworkers, emergency responders, and even strangers, people who use the tools that you now have too. Remember, it's likely to be a friend or a loved one, not a stranger, who needs you to step in and help save their life.
By taking action and using the CPR and first aid skills you learned here, you could make all the difference in a real life emergency. You're ready, you're willing. You can save a life. Welcome to the nation of lifesavers.
All right, perfect. Let's take 5 here and come back to do some high quality CPR.